I'd like to welcome you to the Flinders University 2026 Nursing and Midwifery Employer Showcase. A very warm welcome to you all and to those who will be joining us by watching the recording. My name is Meg and I'm a career readiness consultant in the graduate career readiness team. I'm joined by my colleague Leticia, who has coordinated what is going to be an amazing event today. So thank you, Leticia. We've also had wonderful support from our IT team, as this is the first time we are running this event online, and huge thanks to them. I'd like to begin by acknowledging we are bringing you this event today from the traditional lands of the Kaurna people and pay our respects to elders past, present and emerging. As we gather today, we do so ahead of National Reconciliation Week, which is 27th of May to the 3rd of June. The theme for this week is All In, a call for all Australians to commit wholeheartedly to reconciliation every single day. And as we are meeting virtually, there's going to be an opportunity to meet with many employers in person at our Health and Community Services Festival on the 6th of August. So do save the date for that. Now, we have quite a schedule today, so we'll be moving through as efficiently as we can. So you'll see most employers will be doing a 15-minute presentation and there will be 5 minutes for questions. SA Health will be doing a 75-minute presentation with 15 minutes for their questions. And do note that we've organised a Q&A at 1 p.m. with your nursing teaching academic staff. So if you've got questions that relate to more of those university and academic matters, we do ask that you keep those questions to that time slot. We've got a little bit of housekeeping. Now, the session is being recorded. Do be aware your camera, microphone and chat functions won't be available, but you do have access to the Q&A function in Microsoft Teams. So just be mindful of a few things around questions. Try to keep them broadly relevant to all attendees. If it's a highly individual and very specific question, this probably isn't suited to this format, and I'm sure each presenting employer is going to let you know how you can follow up with them for those sorts of questions. So this is just highlighting for you, this is the Q&A function. You can see it in your toolbar. You can type in your question, click send. It'll be visible to facilitators. You'll also be able to see the questions that other attendees have uploaded, and you can also click the thumbs up or upvote button. So try to check if somebody's already asked something similar to you, and we're going to prioritise, of course, the most popular questions. So thanks again for joining us. You've got plenty of resources on Career Hub. I'm sure you're very, very well aware of those, and we hope you have a really productive day today. Okay, so after this, you will be receiving the recording, so the location of the recording and, of course, all of our resources. So I'll hand over to Leticia now to bring in our first presenter, which is Kristen from Burnside Hospital. So Kristen, we'll get you set up, ready to go. Thanks for joining us.
Good morning. Hi, how are you all? Can you see the screen okay?
Yes, we can see the screen.
Excellent. And I'd also like to introduce Jane, who's with me today. She is our educator from the maternity department.
Hi, everyone.
Good morning.
Okay, so just a quick introduction. Jane McLean, I'm a dual registered midwife and nurse as well. I've been working overseas for several years, and I've just started at Burnside over the last year, and I'm really, really enjoying it. We wanted to let you know a little bit about our hospital.
Yeah, and Kristen Cheeseman, I've been a registered nurse for, I think, 26 years, been at Burnside Hospital for the last 7 years, and I look after education in the perioperative department.
Shall we go forward?
Yeah.
Okay, so just a little bit about Burnside. We're actually two hospitals, but we share the same commitment, and that is to care for our community and be a wonderful member of our community. We're a leading private, not-for-profit community hospital, and we really do have a diverse set of clients and provide healthcare needs to thousands of patients every single year who trust and provide in the care that we provide. And that's one of our main things that we like to always say, is that we provide exceptional care always.
So a little bit about the hospital's history. You might be familiar with our original hospital up here at Toorak Gardens with the beautiful old house, Atunga, on there. That was donated to the community by a man called Otto von Reben about 80 odd years ago, and that was to create a hospital for the community. Originally the purpose was to look after returned servicemen from the war, but over time the kind of the remit of the hospital has expanded, and we've brought in more and more different services. But one of the wonderful things about having that house and the garden donated is that the garden always has to be maintained for the benefit of the community. So it's a really lovely environment to be in, with people dog walking and having their families for little picnics in the gardens, and the staff enjoying the gardens as well. So it's a really lovely environment for us to be in.
So we do have two locations now. Our original site is Toorak Gardens, of course, established in 1944, and it has 76 beds, 5 operating theatres. We do a lot of day surgery, of course, our maternity department, my place. We do have a HDU and CSSD, etc. on site. We are also expanding. We'll tell you a little bit more about that later. But then we did join up with Stepney Hospital. It was formerly SportsMed, a very orthopaedic, almost 100% orthopaedic surgical hospital that was established in 85. It was about 3 years ago that we joined together. They also have 49 beds, 5 operating theatres, and they also do a little bit of plastic and reconstruction surgery now. Still a lot of orthopaedics, but the staff are really enjoying doing a little bit of different surgeries as well.
And probably the thing you're going to be wondering about is, what is it like to work at Burnside Hospital? And every hospital has a vision and a purpose and an approach. But I really like to think that the way that we work and the way that we interact with each other and our patients here does live and breathe that purpose, vision and approach. So we do strive to provide exceptional care always, and to be the trusted hospital of choice for our patients, our people, our partners and the community. And we really embody this approach in our work, the way that we are with each other, the way that we are with our patients. People often comment that it feels like coming to a country hospital in the city. Everybody's very friendly. Everybody says hello to each other in the hall. All the departments know each other well and work with each other really well. And I feel that it is a very welcoming and friendly hospital to come and work at.
Here's our specialties. Actually, I'll let you talk about this because mine's one part of it.
Well, do you want to tell us a little bit about your maternity department, and then I'll talk about the rest of them? How about that?
So the maternity unit has 4 labour and birthing suites, about 16 postnatal rooms, although we do have the potential to overflow. We do have a level 4 special care nursery as well. It's a lovely, small but dynamic team that works really well together. So that we can support each other and be good teammates and co-workers as well. We really are a family that works together here.
Yeah. And for us in the nursing side of things, as you can see at Toorak Gardens, we have a lot of different specialties here. So a lot of different surgeons coming and doing different surgical specialties. We also have a sleep centre where they diagnose sleep disorders. And we also have an oncology unit where they do infusions, chemo infusions in their up in that clinic. One thing you probably notice that we don't have is an ICU or an emergency department. So what that means is that almost all of the work that we do is elective surgical work. plus then the maternity and the sleep and the oncology. But the rest of it is elective surgical work. And what that means for us in our practice is that it's actually quite well planned. We're not managing emergencies coming in off the street or traumas or really unwell people. We're able to screen our patients coming into the hospital, to know who they are before they come to us and to have a plan of their care before they've even arrived in the building. So it does give patients a really seamless experience coming into our hospital. So yes, if you're interested in a large range of different kind of specialties, then Toorak Gardens is probably the place for you. If you're someone that's got a strong surgical orthopedic kind of mindset, then Stepney might be the place for you. Yeah.
Just a few numbers here. Well, you guys can read that, but we do a lot of procedures, a lot of surgeries here at Burnside Hospital. We're almost cracking 1,000 babies, but lots of sleep patients, chemotherapy, lots of overnight stays, and day surgeries as well.
Yeah. Over time, we're finding more and more surgeries are able to be done as day surgery procedures. Even things that in the good old days we would have admitted patients overnight. Nowadays we do a lot more day surgery and a little bit less of the overnight kind of stays. So what's going to happen if you come and work at Burnside Hospital? Well, we do have lots of opportunities for career progression and role diversification. We support our staff with their continuing education, and we also provide financial support for people wishing to undertake postgraduate studies. We have an employee assistance program where you're able to access free confidential counselling, and that is for staff and their immediate families. And we also have an arrangement with one of our physiotherapy providers to have free physiotherapy consultations for staff. Being a not-for-profit hospital, we're very fortunate that we have excellent enterprise bargaining agreement, which means that you get a bit more bang for your buck with your salary. We have generous salary sacrifice scheme. We have free car parking in the streets around the hospital, which is a really great benefit for people who have worked in the city and know how expensive and difficult it can be looking for car parking. It's a really big benefit being able to just park in the surrounding streets. We've got a lovely on-site cafe at both sites and kitchen where subsidised healthy meals are available. We have throughout the year staff barbecues and celebrations. So next week we'll be having a couple of different events for Reconciliation Week, and then coming into June we'll be having our focus on Pride Month. So we do lots of kind of focuses like that throughout the year. We offer years of service awards, and we do have a lot of staff that stay with us for a lot of years. So we've got staff that have received recently 30-year service awards, which is pretty amazing. And we also do like to recognise good work with our staff with the Burnside Bright Stars Award as well, that every month people can be nominated and, fingers crossed, win a cash prize for being a Burnside Bright Star. So lots to look forward to and enjoy at Burnside.
So the transition to professional practice program here, we offer 4 different streams, I guess, So there's a perioperative services, which is your scout and circulating. The anaesthesia and PACU, or anaesthetics, sorry, I say it wrong all the time. A surgical wards one as well, and then of course our maternity services. That's just available at Toorak Gardens only, and you must be a midwife to be able to participate in that maternity services.
Yeah. So you can see the picture of some of our lovely transition nurses from last year, and it's always a really great year seeing people kind of growing throughout the year and learning those different roles. So every year is a little bit different because we are a smaller hospital and it's a smaller number of grads that we're taking. We can kind of customise and tailor how our grad year goes depending on the wants and needs of our grads. So everybody that you see there all had a different grad year. They all had different rotations. They all had different learning goals. They all had different things that they were focusing on. But it does make for like a really nice kind of a boutique experience. I think having that, you've got our full attention and all of our support throughout the year. So I think we have a really lovely year together.
And I think that's definitely the case in maternity, just based on activity that's going on. It's very driven to what you're currently needing and then what's available on the unit at the time, so that we transition you through all of the areas of our clinical practice throughout the year.
So our program for 2027 will start in February, and important thing to be aware of is that we are offering ongoing employment. So you're not just signing a 12-month contract, you are going to become a part of our team and have that certainty of knowing that you've got a career path ahead of you with us. We have internal grad study days. So I can tell you from the nursing perspective that we have our study days all together. So the Toorak and the Stepney nurses from both the wards and the perioperative streams, we're all together for our study days. We have kind of some universally interesting topics in the morning for the big group, and then after lunch we break off into our streams and do a bit more kind of focused learning that's more relevant to our clinical areas. I'll let Jane tell you about maternity study days.
On the next slide, actually,
okay,
because we've got it outlined there.
Okay.
Yeah.
And we also have within our nurses and midwives, we have clinical coaches, and those are people that have undergone a bit of additional training to understand how best to support graduate nurses and midwives in that transition year. So you also will be assigned a clinical coach that they will follow you throughout the year and help you with everything that you might need as you're learning the role on the floor.
As the maternity is slightly different in that we usually only have 2 or 3 transition to professional practice midwives at a time, and so just such a small group. We've joined with Lyle McEwen Health Service to work with them so that we can join part of their team. It also includes a 2-week placement with them just to get a little bit more volume in the birthing suite for a week, as well as some additional work in the special care nursery. That's one of the biggest things for us, is our special care nursery is not open all the time, and so it can sometimes be few and far between when you get some opportunities to work in there. So this is just to help solidify some of that learning. And you can see the study days there are joined with the team in Lyle McEwen.
2-minute warning, ladies.
Thank you.
No worries. So who are we looking for? We are looking for passionate, dedicated graduates who are ready to start their career in a progressive community hospital, which is us. And throughout that program, what you can expect is to have a really good orientation and plenty of supernumerary time to learn your new role, to grow your skills and your knowledge under our guidance and with our support, to build your confidence and to explore your special interests, deepen your clinical knowledge, and continue to grow and learn throughout the year. This slide was just to give a little demonstration of what some of our previous graduate nurses have been able to achieve through their employment. So you can see that everybody does have those opportunities when they come on board to be extended in their role and to be actively looking towards promotional positions as well. So lots and lots of opportunities through our hospital. Here's one of our beautiful nurses who did her transition year in 2023, and she's upstairs working this morning in the anaesthetic department. Neith was an exceptional graduate nurse with us, and she learned 3 different roles and has become a really, really important person in our perioperative department. So just such a wonderful experience for both her and for us growing together in that role.
And this is Montana, who completed her transition to professional practice in 23. Again, another amazing midwife who quickly developed into becoming a great team leader with us, learning comfortable in all areas of maternity and becoming a great mentor for and coach for all of our recent grads as well.
So we will be opening our applications on the 1st of June. If you would like to navigate to our website and look at the current opportunities on the 1st of June, you'll see the job ad will be up for the transition to professional practice year, and we really look forward to hearing from you. We're also very open to emails and phone calls. If you want to know more about the hospital or you want to come in for a tour and have a look around, you can get in touch with us, and we're very happy to help you out with that. We look forward to receiving your applications.
Mm-hmm.
Thank you, ladies.
Great, thank you.
Everyone online, we're now opening the Q&A, so feel free to write your questions for Christine and Jane.
No questions? We usually get questions about car parking, but I think we already talked about that one.
Mm-hmm.
Sometimes people ask us as well how many grads we're going to be taking on.
Mm-hmm.
And I think we would like
3.
3 midwives.
Mm-hmm.
And we would probably like around about 10 nurses across our different streams and sites.
Mm-hmm.
So a small but hopefully good group would be great for us.
Mm-hmm. I did mention earlier that we are having some growth at our hospital. We are building a new
day surgery, across the road.
Yeah.
So yeah, we're a growing hospital.
I guess I'll put a question out there. I've always got. We've got a couple of questions.
Mm-hmm.
Are there multiple rounds of offers?
Mm-hmm.
Are there multiple rounds of offers? Probably not, because it is just a small number. Hopefully we'll secure the right candidates from the first round of offers. Not very likely that we'll do multiple rounds of offers. And how long are the applications open for?
That is a good question.
Yeah, they're open for a good couple of months.
Mm-hmm. I was going to say, though, that sometimes it can be that, life happens and someone maybe accepts one of the TPPPs with us, but then has to move on to something else. So that it could be, if you could reach out to us for opportunities, because sometimes we do have some movement and changes within that. So you could always reach out later in the year if you wanted to ask more questions about it.
And I'm just confirming that it is the whole month of June that the applications are open for.
June.
Is the 2-week placement at Lyle McEwen, that the 2-week placement at Lyle McEwen is just for the midwives. So the nurses, all the study days are internal study days.
There was also a question on how will the interview be conducted?
One-on-one in person.
Yeah. And we've got a question, do you require IELTS PTE scores for application process?
No.
Okay.
We just want to know who you are.
Yeah.
We're not too worried about your academic transcript. We want to know who you are and whether you're going to be a good fit for our team.
So any key tips then, just to finish off, that you'd give them on that recruitment processes?
Well, one of the things I'm always looking for, because I'm looking for perioperative nurses, is I want to hear why are you interested in the stream that you've applied for. So if you've got a passion for anaesthetics and that's your dream in life to be an anaesthetic nurse, I want to hear about it in your application. We get lots of applications that tell us that I've done clinical placements and I can do medications and I can do, patient care. Well, and we know that you can because you've just finished your nursing degree. But what sets you aside from the rest of the applicants is telling us a bit about you, who you are as a person, what you're looking for in your career, what your your hopes and dreams are for the future, and that will really help us to understand who you are and how you might fit into our team.
And just pay attention to detail, because we do thoroughly look through and read everything, so making sure you answer any questions that were possibly in the application.
Sure.
Qualities we look for in a graduate nurse applicant, it's the fit. It's the good fit with our team. So knowing who you are, knowing what you want, having that kind of clarity of your career goal.
And I'm sure the website's going to make it clear which documentations you're going to need for the application, because we are at 9:25. So I think we might need to say a huge thank you, Kristen and Jane, for a very interesting and informative presentation. So thank you so much for joining us today. And just checking, Rachel, are you with us as we move to Rachel, who will be from the Far West Local Health District in New South Wales, Broken Hill Hospital.
Yes, I am. And I've also got Ivy with me as well, who's my clinical nurse educator for new graduate support.
Oh, fantastic. That's wonderful. Welcome.
Thank you.
So you are welcome to share the screen now and get underway with your presentation.
Thank you. Hopefully everyone can see my screen.
We can see your screen.
Awesome. So briefly, my name's Rachel. I'm the Nurse Manager for Education and Professional Practice out here in Far West. I've been out here for 11 years and I'm an ex-Flinders alumni. I did my Bachelor of Nursing with you guys. And I've also got Ivy with me, who's my Clinical Nurse Educator for New Graduate Support. So firstly, I'll start with an acknowledgement of country. So the Far West Local Health District acknowledges the traditional owners of the lands within its boundaries, including the Barkindji, the Muti Muti, the Willikali, the Nyampa, the Woodagali, the Mulli-Ngamba, and the Wankamara. We acknowledge and pay respects to elders past and present and their ancient wisdoms. We also acknowledge the communities of today and the Aboriginal community members who are a part of our communities. So a bit about Far West. Far West Local Health District is geographically the second largest of the 15 local health districts across New South Wales, as you can see by the map of New South Wales there. We border 3 states, so Queensland, South Australia and Victoria, and we cover about 200,000 square kilometres in remote New South Wales. We are sparsely populated, with the majority of the population in Broken Hill, which is our base hospital, and the remainder of the population live in agricultural towns along the Murray River in remote communities of about 80 to 800 people. So as you can see, we've got Tibooburra, White Cliffs, Wilcannia, Menindee, Ivanhoe, Dareton, Wentworth and Balranald. So that's all part of our Far West Local Health District. And we've also got the highest proportion of First Nations people in New South Wales, with about 12% of the population. And just some clarity about where we sit. So we're 40 k's from the South Australian border. We're about 5.5 hours from Adelaide by drive. So you guys are basically we're basically part of South Australia, except we have to report to Sydney. Sydney is a 12.5 hour drive, and then you've got Mildura on the border there, which is about a 3 hour drive from us. So yeah. In regards to our service, so the Far West, we employ about 800 staff across the 9 facilities, which include like public health facilities, multi-purpose sites and primary healthcare centres. Broken Hill is our base hospital and is the largest health service in the region. We work closely with other stakeholders such as the Royal Flying Doctor Service, so for primary healthcare and aeromedical retrieval. We've got Aboriginal health services like Marramara and Kumiala Health, and then we've also got other partners that we work with. So we work with South Australia Health quite closely, because Adelaide is our tertiary facility where we send our patients to. A bit about our new graduate program. So the Grad Start program is the equivalent to South Australia's TPPP and is run by the New South Wales Nursing and Midwifery Office. It is our annual statewide program that recruits new nursing and midwifery graduates, and we recognise that it is an exciting stage in you guys' nursing and midwifery careers, and our program focuses on supporting new graduates to thrive professionally and grow in your career. So what we offer a variety of rotations across all our wards and sites, so across 4 remote health service sites and all our wards and units within the hospital. We have a formal orientation process that we get you guys to run through, so you're prepared to start. Because some of our remote health service sites, we run the ambulance service, so we provide 2 days of ambulance training. We have dedicated clinical nurse educator, which at the moment is obviously Ivy, and other clinical nurse educators that sit under me that roam around the district as well as the hospital. We have a minimum of 5 fully paid study days that we provide as part of the new graduate program. We have preceptors and mentors that we provide with our new graduate staff. We have rural metro exchange programs with other health services in New South Wales, and then we've also partnered with CQ University for postgraduate certificates in nursing. So with our new graduate rotations, so with starting off with Broken Hill, which is a 98-bed rural teaching hospital, we have a 24-hour emergency department, which has just been newly updated and renovated, which is looking quite smick. We have a variety of wards that we offer our rotations on, including the emergency department, maternity, surgical and medical wards. We've got mental health inpatient unit, mental health, drug and alcohol, which is a community setting, operating theatre, ICU, PEDS, and community or ambulatory care. With our mental health new graduate program, it's a 12-month program where you do 6 months in mental health inpatient unit, 6 months in community mental health. We have partnered with other local health districts within New South Wales to provide a very structured program that will make you sound clinicians by the end of your 12 months to practice professionally within that mental health space. They offer their own specialised study days within this program as well, and it's very much supported. We also have a 12-month new graduate program within the operating theatre where we rotate our new graduates through day surgery, scrub, scout, anaesthetics and recovery. It's very hands-on with its learning, very much supported, and it's an opportunity to build your confidence and competence within that operating theatre space. With our remote health service, we have 4 sites that we send our new graduate nurses to. So Wentworth being one, which is a hot brand new facility, which has just recently opened up its urgent care clinic, which is all exciting, new and fresh. We have Balranald, which is a multi-purpose site. So it's got a 24-hour ED as well as a aged care facility, and it's right on the river. We have Tibooburra, which is more of a clinic, but it does have an ED as well, and it runs the ambulance service. So lots of rodeos, gymkhanas, all that out there, lots of injuries. And we've got Viv, who's the HSM out there, who's basically a living idol. And then we've got Wilcannia, which again is on the river as well. It's also a multi-purpose site where it's got a 24-hour ED, it runs the ambulance service, and it's also got an aged care facility. We also offer, as part of our potential grad start program, is our rural metro exchange, which we've got agreements with Central Coast and Southeastern Sydney and Sydney Children's Hospital, where we spend 6 months either on a site in Broken Hill, and then you swap over 6 months after and head to one of the bigger metro city hospitals, which gives you a good idea of the differences between the different types of nursing and the hospitals and such. Some of the study days that we offer. So as part of orientation to the sites, especially if you're doing rotations in Wilcannia or Tibooburra, we offer a 2-day theatrical and practical training by New South Wales Ambulance for ambulance training. So basically it goes through the ins and outs of the vehicle, how to provide first aid treatment, and yeah, making sure that you drive the ambulance safely, know how to turn the sirens on, and can work the radio. With our 5 study days that we offer our new graduates, so that supports early career in nurses and midwives to build resilience, develop advanced clinical skills, manage complex patient care, recognise deterioration, and plan their professional growth through interactive and simulation-based learning. So what can Far West offer you guys? So I'll hand over to Ivy. Hopefully she's
Hello.
on.
Hi there, my name is Ivy, as Rachel said. I'm the dedicated CNE for new graduate support. My main role is to foster growth for all the new graduates under our program through orientation, education, mentorship, and structured development opportunities. My primary goal is to help new graduates build their clinical capabilities and their confidence, and to support their career progression across wherever practice settings they are, be it in Broken Hill Hospital or in the remote sites in the district. My background is rural and remote nursing, so I very well know what you guys are going through in your first year as new graduates.
Thanks, Ivy. So a bit about our Central Queensland University graduate certificate. So we've partnered with CQU as they recognise our Grad Start program to providing 2 units of RPL towards a graduate certificate, which means that during your Grad Start program, there's only 2 units that you would have to complete to have a grad cert at the end of your program. So that being patient deterioration in the clinical setting and nursing and clinical governance. This is again supported by Ivy. So there's lots of practical and simulation in regards to those units, and we partner with CQU to help make that easier for you guys. And basically, not many programs you can get a graduate certificate at the end of for your Grad Start program, given that most graduate certificates you need 6 months experience, postgraduate experience, to be able to even apply. So it's very exciting. So what we can offer as a graduate program, so we've got a small number of graduates, so we look to about 30 graduates over as Far West as a whole, and we have a large number of resources. We have a lot of autonomy in our care and very much accelerated career learning and development. We have a strong sense of community. We've got low population. Everybody knows everyone, and you basically embed yourself within the community. We have great career progression and growth opportunities, and like I said, we're one of the only health services that run the ambulance service, and we put you through that training to be able to provide that, to actually fulfill that service. So how to apply for our Grad Start program. So if you Google Grad Start New South Wales Health Campaign, it'll give you all the information. I've also put some key dates there. So with Tuesday the 16th of June, where applications open. On the 29th of June, applications close at midnight. On the 21st of July, we send out our interview invitations. I'll get my words out shortly. And then we hold our interviews between the 3rd of August and the 28th of August, which is about a month. And then hopefully by October, you'll receive an outcome for recruitment. So just some tips and tricks with your interview. So be authentic. It's okay to ask for a question to be repeated or reworded. Have a pen or paper handy to jot down points or questions. Take a breath before answering. It's okay to pause and think. It's not going to be held against you. And use examples from your experience to support your answers. And I guess that's me done. So if you've got any questions or want some more information or anything like that, please feel free to reach out. My contact details are there. Happy to help however I can.
Thank you, Rachel and Ivy. Really interesting to hear about the program and the opportunity with ambulance support and all of those really, interesting things that are unique to your setting. So we have Q&A running, and we've got a question. For applications, I note that we require a WWCC. How do we get around applying for this if we live in South Australia? As I've only seen, hang on.
I can apply with a New South
Yeah.
Wales address.
Yeah.
So the Working with Children's check. So you can normally get around it. You can still put your application through, and they'll just ask you to have your Working with Children before you start working. So if you move to Broken Hill, which hopefully you will, it takes about 48 hours to get your Working with Children's check. You just go down to the local service, New South Wales, they put it all through for you, and as long as you provide it as evidence before you start, you're all good.
Yeah, great. So the key thing is to get the application in, and then you can do that on relocation.
Yeah.
Any sort of tips for the application, Rachel?
I think, try and sell yourself. Like I think Burnside mentioned, you guys are graduating. We know that you can be a nurse, but what stands you, like how do you stand out? We are looking for someone who's very patient-centered focused. We're very much community-based. You know, for example, we've got a few kids in the community that are quite unwell, and it's the whole community gets around them to help support them. And the hospital's a part of that. So yeah, we're looking for personality.
Yeah.
Yes, there is accommodation as part of the job. So we've got on-site accommodation for the nursing quarters and at the remote health service.
Yep. Also a question on how many graduate midwives are you recruiting to Broken Hill?
Normally 1 or 2.
Yep.
Because we offer other programs as well in line with that. So we've got things like the Mid-Start program where you can complete your first year of being a registered nurse, and then you can go into our Mid-Start program where they actually support you in a program that you work alongside your study. So you basically get that hands-on experience. So they take up our Grad Start numbers as well for midwifery.
Okay. So we'll keep those questions rolling in, getting some really interesting information there, Rachel, really getting a sense of team and culture. And we've had another question around accommodation support, and also do you give priority to applicants from New South Wales and Queensland?
There's no, priority to New South Wales, yes, but given our location, a lot of people from Sydney, it's very much harder to get home from Sydney than what it would be to come back from Adelaide.
Yeah.
So that's where our isolation is kind of a barrier in that sense. But yeah, no, we hire internationals, we hire, everyone. We give everyone a fair go.
That's lovely to know. Now, a question about, will the interviews be conducted online?
Yeah, so it's normally online via MS Teams, and there's usually 2 people in the panel.
Yep. And any tips for the online interview?
Be on time.
Yeah.
Make sure your tech works prior. And just be your authentic self. Like I said, take a breath. It's okay to pause, because I think, interviews are very stressful, and we don't want to promote that anymore. I think, me and Christy last year when we were doing our interviews would ask silly questions at the start to kind of loosen up a little bit.
Yeah.
Because we try not to cause too much stress with the interview process, because you can cloud your judgment. Yeah. So take a breath, take a drink.
Yep. Anything's not to do for an online interview?
Probably the obvious things.
Yeah.
Don't be rude.
Yeah.
Just be yourself, honestly. Like, we're looking for authenticity.
Have you seen any sort of people with crazy backdrops or pet incursions?
Oh, we've had crying children, but that, that's a part of life.
Yeah.
Have your camera on. I want to see your face.
Oh,
it's nothing worse
good one.
Nothing worse when you can't see who you're talking to. Yeah, I think that's about it. Have your camera on.
Yeah, wonderful. Just love it, Rachel. It's great to see you, and thank you to you and Ivy for giving us a real on-the-ground perspective, and I hope you get lots of great applications.
Yeah, we're lovely out here, so please pick us.
Yeah, fabulous. Okay, I think we are ready to move across to Imogen from St Andrew's Hospital. So thanks, Rachel. Thanks, Ivy. Have a great day.
Bye.
And welcome, Imogen. You can proceed to share your slides.
Hi, thanks all for coming and letting us be a part of it. My name's Imogen. I'm the graduate coordinator at St Andrews, and this is my colleague Alison, who is the clinical education facilitator for the wards in our hospital. We'll just get our slideshow organised. I just want to make sure, are you guys seeing the full screen? Is our PowerPoint full screen?
Not the full screen. Now we do.
Now you do? Beautiful. All right, so a little bit about us. St St Andrews is the largest standalone private hospital in Australia. We have 240 beds and we admit about 43,000 patients per year. We do cover most specialties at St Andrews, but we don't deliver babies and we don't do eye surgery, but we do just about everything else. Of our 43,000 patients per year, we do roughly 25,000 elective procedures annually in our 12 theatres, our 3 procedural rooms and our 2 cath labs. St Andrews is located in the southeast parklands of the CBD. We're surrounded by beautiful gum trees and we're actually just around the corner from all the cafes and restaurants on Hutt Street. So you might not even know we're here because we're tucked off of a busy road. Our TPPP intake varies year to year depending on the demand of our hospital, but we roughly employ between 20 and 30 graduates, which include both local and international nurses. Now, our program is a 52-week program and we offer ongoing employment following the conclusion of this. Our start intake will probably be early February. Now, what I want to talk to you most about today is the support that our program offers, and that ultimately is what we think sets St Andrews apart from other programs. I can say hand on my heart, we really support our grads. To us, you're not just a number. We have personal relationships with all of our grads. We know who you are and we look after you. As the graduate coordinator, I'm one of the primary preceptors for the ward and our procedural street graduates throughout the year. We run 5 specialised study days, which are staggered throughout the program. This is where you leave your clinical areas and you come over to a safe environment to learn clinical skills, complete workshops, you have guest speakers. It provides you an opportunity to interact and really build lasting relationships with the other grads as well. Our peri-op program looks a little bit different, and although you don't attend the same study days, you're very well supported throughout the year. You have very close relationships with our theatre educators, and they also run a number of supernumerary days. We also have educators in anaesthetic and recovery and critical care, which is our version of an ICU. Now, ultimately, why I think St Andrews is so amazing is because of our hospital culture. We really are a close-knit team and we value the interpersonal relationships across our entire organisation. This goes beyond nursing staff. It includes kitchen staff, cleaners, maintenance, admin, volunteers. I can say confidently that anyone that comes through our doors is part of this community. We also do salary sacrifice packaging for our hospitals, which means more take-home pay for all of our nurses, and we have competitive private sector pay rates. One of the things that graduate nurses love about St Andrews is the incredible parking we have surrounding the hospital. There is free street parking, which a lot of our staff use. Otherwise, we do have a gated underground car park, which is for a very cheap daily rate. You basically take a lift and you're up in our wards, so it's very easy to get to. We have a few more staff benefits and discounts that we think is really important here. That includes our employee assistance program. We have a Wellbeing Wednesday, and we have a staff recognition program which is called our Standout Awards, and this is where your colleagues can nominate each other every month if they believe you're kind of mirroring some of our St Andrews values. You go into a monthly draw and you'll win a prize. On top of that, we have a completely run on-site kitchen. This is where our amazing patient meals are provided, but the kitchen team also run a cafeteria which is accessible for our staff and our visitors. And we have a volunteer-run coffee shop on our ground floor. Part of another perk that you guys can get if you're a St Andrews employee is 20% off store-wide. It's got a little gift shop. They do a really amazing job down there as well. The last thing that I think sets St Andrews apart is our incredible St Andrews Hospital Foundation that we have. This has been running for more than 25 years, and our foundation provides assistance through funding life-saving equipment for our patients and our hospital. They also provide funding for creating spaces amongst our campus or our grounds that improve the care and comfort we're able to provide for our patients and their families. One of the amazing initiatives our foundation implements is supporting ongoing clinical training and development for our staff, which is through providing scholarships for further study. This slide here just gives you a little snapshot about what some of our recent graduates have said about our program. I won't spend too long on this slide, but if you feel like you would like to go back and refer to them, they are on our website, or you can always have a look at the PowerPoint at the end of the presentations. We have 2 specialty TPPP streams that we offer at St Andrews. The first one is our 12-month perioperative program. It is a full year in either a scrub scout role, recovery and anaesthetics, or within our procedural suite, which includes DOSA, day surgeries and our scope rooms. This 12-month perioperative program is primarily Monday to Friday. You get 4 weeks of annual leave, you don't do night duty, and you score your public holidays off, which is wonderful. Our other program is our 12-month ward specialty program. So this is a 7-day roster. It's more of a shift work style, and you also will have a couple additional weeks of annual leave, and you score shift penalties. Now, for our ward specialty program, you spend approximately 6 months in 2 specialty areas. I won't go through all the areas, but they're on the screen in front of me. So as you guys can see, you get a really good variety of specialties within the different areas, which makes it really amazing when you're learning and you're trying to soak in as much information as possible. Both of our programs have really extensive orientations over our first 2 weeks. And as I mentioned, we have our study days and a lot of supernumerary time. We also run a preceptorship program at St Andrews. This is where preceptors are selected in every area, and our grads will be provided mirrored rosters to start when they're beginning their program. It means that you've got a familiar face that you recognise and someone that you feel comfortable with coming to work with, especially when it's, just feels a bit overwhelming. Now, we all know you have a life and we want you to as well. So our managers try really hard to provide flexible rostering shifts within their means. This means that staff can nominate shift preferences to fit in with their personal lives, but it also allows the hospital to be staffed safely. My biggest piece of advice is if you're looking to apply at St Andrews, please follow our application instructions clearly. This may be the difference of whether you're offered an interview or not. We value short, succinct, straight to the point applications. Having a long application doesn't necessarily make it better. So we'd like you to convey who you are and what it is you're about. We want to get to know you guys in a snapshot. I'm sure everyone else is telling you the same thing, but if you're invited to an interview, ensure you're on time, you're well presented, and spend a bit of time learning something about St Andrews and what it is that we do. Now, I did mention earlier, but just a heads up, the perioperative program is very competitive, and that kind of is statewide. So be flexible and open to your preferences. Many of our past graduates haven't had a placement in a private hospital, so please don't let this impact you whether you're considering applying or not. I can confidently say that our grads are pleasantly surprised about the diversity of our patients and ultimately chose St Andrews to do their TPPP due to the incredible leadership, staff retention and opportunities for career progression. A lot of our senior staff, managers, clinical nurses and myself included all completed their TPPP within the hospital. As part of your application, we ask for 3 clinical references, but please note they do need to have a minimum of 3 years experience. This can include facilitators, clinical nurses, ANUMs, NUMs. We'll also accept management from any other healthcare related employment. We do understand some of you may not have 3 senior references at this stage, so we will accept additional references once the applications have closed. So if you happen to have an upcoming placement and you're able to get another senior reference, feel free to contact us and we will take that on board. We do conduct group interviews in July and they'll take approximately 1 to 1.5 hours each. Now, as I mentioned, please note we don't interview everybody, which is why your applications are so important. If you're shortlisted, we'll ask you to complete a health assessment screening and we'll do your reference checks at this point. The offers will commence in September and they'll go through to about November or until our positions are full. And we'll also let you know what rotations we're able to provide you at the time of offers. Our applications for our program opened today and they remain open until Wednesday, the 1st of July. Please note we have a strict deadline cutoff, so no late applications will be accepted. The QR code at the top of this page will take you directly to our graduate nurse program page on our website, which is where you'll have everything you need to know. It'll have clear instructions on how to apply. And as I mentioned, I really want to make it clear, please follow these instructions. Because of the mass amount of applicants that we get, it may be the difference of whether we can offer you an interview or not. My one piece of advice, is prepare your resume or your CV and your cover letter as one document. This is what you upload within the CV section of your application. We also have a St Andrews application form, which is what you'll upload as your cover letter. So they are going into different sections. We have an information evening coming up on the 11th of June for anyone who's interested, and we would love to see as many of your friendly faces as possible. But please note you must register if you'd like to attend. So the link to the registration can be found on our careers page on our website as well, but it also is the Humanitics QR code at the bottom of this page. If you're keen on St Andrews, come along. We'll have more time to meet you, we can chat to you, answer questions, but it also allows you to meet some of our educators and our previous graduates. We'll just spend a little bit of time now answering any Q&As through our Q&A section, so feel free to write any questions that you guys have. And lastly, I'd just like to say I'd encourage you all to follow us on social media. We spend a lot of time kind of prioritising who we are and creating an online presence. So it just allows you to kind of familiarise yourself with the hospital and get to, know and recognise some of our familiar faces.
Okay, thank you so much. And please pop your questions into the Q&A. I should also mention that, we're gathering up all of the PowerPoints, and so we'll also have them available for you. Wonderful information, very, very comprehensive. So just waiting for questions to come through.
If you guys think of any questions after, today's kind of opportunity, on the website is myself and Ali's email, so you can always email us through any questions that you think of after today.
That's great to know. Perhaps whilst we're waiting for questions, any tips for the group interview?
Like I said, we really want to kind of get to know you guys, and as you can imagine, we're interviewing quite a number of applicants. So, come in and be energetic. And like I said, having a bit of knowledge and spending a bit of time knowing about the hospital will really be something that kind of captivates us.
Yeah, I did a session for the final year nursing students sort of back in, was it February, March, and really encouraged people to start following on the social media.
Yeah.
Let's see. We've got a question. Any tips for those employed with an agency?
So you're talking about an agency as a AIN or?
Possibly, yeah.
Yeah, so absolutely, you're welcome to apply. There is no reason why you wouldn't be eligible. We have lots of nurses who've been working with agencies when they apply to us for their TPPP.
Yeah. And someone's asked, how many would you be looking to take on?
Probably around 23, we think, but this is the value of working in a private sector in a standalone private hospital here at St Andrews, in that we make up our mind right at the very last minute that we make offers. So we'll really be confirming those numbers in September, because the managers may say, actually, we could do with another nurse, and we'll take more than we might have. So it's a moving target at the moment.
Oh, that's really good to know.
I think the biggest thing is with the interviews is you don't need to prepare anything other than that, as Imogen said, know a little bit about us. And because we don't ask you to bring anything really, it's just come on the day. We're just wanting to get to know you. For those people who are international nurses, you're studying here at Flinders University, more than welcome to apply. We have several international graduate nurses every year, and we find that they are all doing very, very well.
Wonderful. And just a bit of a side question as well, you also employ student nurses, I think.
We do, actually. Thanks for that. We employ student nurses in second year and third year, but obviously you're all third year now. But we employ student nurses as opposed to AINs. We don't have an AIN position here at St Andrews. They are student nurses in second year, and if they're in third year, they get a promotion and a pay rise, and they go up to third year. And they can do all the things that you would normally do when you're on your practicums. So you can give medications, you can take observations, BGLs, ECGs, you're part of the team, and you become, you're settled on one area. So you have a manager, you have colleagues, and it's a really great introduction to the world of nursing.
Fantastic. And how do they find out about those opportunities?
Well, the best thing to do is, if you're interested and would like to be considered for a student nurse position at St Andrews, we've decided that there's not an ongoing ad for that. All you have to do is come to the St Andrews website and send an application in, and it will find the HR department, who will then contact the managers. So please just express your interest.
Yeah, look, we did encourage penultimate year students to join if they were interested. So we might well have some second year students sort of tuning in to get the intel for next year. So that's sort of partly why I was pursuing that one. We have had a question, are there multiple rounds of offers?
So what we do is we'll start offers in September, and we will do what every single other hospital does. So that's why our offers will probably go through to November, because we will be making a round of offers in September. We'll find out whether everyone's accepted those. If not, we'll have another round of 2 or 3 weeks later, and we'll see if they've accepted. And we keep going until we fill our positions. So that could take some time. So every hospital will have several rounds.
And really important for the students to be very attentive to communications and emails.
Yeah, and we find that sometimes in the past, when they're filling out their application, people have accidentally had a typo in their email address, and that means we can't communicate to you anymore. And that can be quite tricky. So please double check everything. Sometimes we will wonder why we haven't heard from you, and we'll check your CV to see if there's an email address that matches there. But check your spam folder too, because hospitals use recruitment systems now, and your particular email provider might have seen that as a spam and put it in your junk folder. So we always absolutely stress, please keep an eye on your junk folder during recruitment time.
And a very good practice anyway. But Alison, thank you so much for that tip. We do have another question. What does a health assessment involve?
Yeah, it's pretty complicated, actually. You've got to fill in a questionnaire to say you're pretty healthy and okay to be a nurse here at St Andrews. And you might need to bend over and show us that you can squat, so that you can squat to empty a catheter, reach up to hang an IV. There's no blood tests, no x-rays, no drug tests, nothing like that. It's just simply a health check, just to make sure you're okay to be a nurse, because work health safety requires us not to put you in a position that will cause you harm.
Wonderful. Well, I think we're coming to the conclusion of this session, and Alison and Imogen, thank you so much for your time. Again, really informative presentation, really exciting. I hope you get lots of fabulous applications from Flinders students. So thanks so much for joining us, and I think we're now ready to move across to NT Health and Alice Springs Hospital with Michelle and Janita.
Thank you for having us.
Alison and Imogen.
Thank you.
Bye.
Bye.
Okay, so over to you, Michelle and Janita.
Thank you so much. Good morning, everyone. So my name is Michelle Dunham, and I work in the Office of the Chief Nursing Midwifery Officer with NT Health. So our office actually manages and assesses the graduate program applications for the whole of NT Health each year. So I'm here to provide you some information about the overall NT grad program and the application component, and then you'll hear from our fabulous graduate education team in Alice Springs. So just first, a quick overview of NT Health, our patient demographic, and the opportunities available to you in your new chosen profession. So NT Health is a Department of Health for the whole of the Northern Territory. It's made up of 5 regions and comprises of 6 public hospitals located in Darwin, Palmerston, Alice Springs, Tennant Creek, Catherine and Nullarbor. And NT Health also provides direct community-based care through 74 health clinics, including 39 in remote communities, and supports a further 133 clinics and services operated by Aboriginal community-controlled health organisations across the NT. So our population in the NT is quite small. It's only 265,000, with a diverse range of culture and language represented throughout. So around 30% of the population of the NT identify as First Nations, and many live in remote and very remote communities. So this can make accessing and providing healthcare both challenging and rewarding, with many people travelling by plane, bus or road to access healthcare. So while our population is small, it is truly multicultural. Our patient demographic in our hospitals and clinics is wide-ranging, with over 200 languages spoken and a large proportion who identify as Aboriginal or First Nations. And we provide services from urban to very remote settings. So a career with NT Health and your grad program will be anything but dull. So a quick overview of the 2027 graduate program. So the applications will open next week, probably Monday or Tuesday, and close in February 2027 to capture those finishing in summer semester. This is quite different to programs in interstate, where the application process only opens for a small number of weeks. So we understand that your final year and you've got a lot on your plate at this time, so we really prefer that you don't rush your application and you take the opportunity to put your best foot, your application forward. So our new website, which I'll provide information on at the end, offers much more information about the expected timelines and timeframes. However, I will note that the earlier you get your application in, the more choice that you have in terms of intake options for your graduate year. So to be eligible for the 2027 Northern Territory Graduate Nursing Midwifery Programme, you must graduate or will graduate at the end of this year, December 2026, between December 2024 or February 2027. You must hold valid working rights within Australia. You cannot be sponsored in your graduate program. And for all of you who may be on a student visa 500, you're very, very welcome to apply and are encouraged to apply. You'll just need to provide either a letter of completion or an updated working visa before you begin the program. And for anyone who may have graduated last year, you cannot have worked for 6 months if you're applying for the program. And for any of you who already may be registered nurses with clinical experience and are applying for a graduate midwifery program, just note that this will actually be recognised in your salary increment. So for example, if you've got a number of years as working as a registered nurse, you can provide evidence of that, and that will be evidence in your salary, your take-home pay. So the graduate website, which I'll provide a link for later, will provide all the necessary information regarding application requirements, the documents that you need, intakes per region, key dates and timelines. So I really encourage you to have a read over that. And if you need any further questions, I really encourage you to contact our office. I'm going to ask you to pay special attention to the timelines and encourage you to apply as soon as possible, as I said. And please submit your application in full. Positions within NT Health graduate program are very competitive. We have applicants from all over Australia. So I really encourage you to put your best foot forward. So before you apply, I really suggest that you read the website information twice, have all the requested documents, do not submit an incomplete application. Make sure your cover letter addresses the essential criteria of the job description and the NT Health values, which are safe, responsive and kind. Make sure your referees are appropriate and responsive. The website will provide a list of everyone who is appropriate, and I highly recommend that you contact them by phone or email and ask them to be a referee. Remind them of your dates and how great you were. It really does go a long way. An unresponsive referee will delay your application. Two other key components of your application is your clinical placement reports, your ANSAT or your AMSAT, and we want them to be your summative version and preferably final year, but one final year and one second year will suffice if you haven't completed 2 final year reports. So some key takeaways for the application programme. We do not interview in NT Health. It's wholly and solely based on your application. You do not wait to need to be registered with APRA before you apply. You can apply and then get your registration before you begin the programme. Submit all requested documents. Your application will not progress without all the requested information. And be aware that this is the first step in your future career. So whether you're still completing placement, applying for your grad year, working as a RUSON in one of our hospitals, your professionalism, your patient care, your willingness to learn and work as a team are really all recognised and appreciated. And as I said, apply as soon as you're eligible and provide all the requested documents. The later you apply, the less choice you might have in what intake that you're offered. So our programme is offered across all 5 regions of the NT, with the smaller hospitals only being able to offer a small number of opportunities or even just a rotation such as Gove. Our Darwin and Alice sites offer a wider range of opportunities and more places. All sites are competitive, so again, your best application really does matter. So as part of your application, you'll be asked to nominate a preferred location and a secondary preference, and also indicate if you're open to opportunities across the NT. I would advise, just for time, if you aren't interested in going to a specific site, don't put one down. If you're only interested in Alice Springs, you might have family there, you've been there, you love it. Same goes for anything else. If you're not interested in any other, just say the same location twice. But if you are interested, please put down other locations. And while every effort is made to place you in your preferred location, this is a competitive programme and we can't always guarantee your first choice. And I really recommend that you're open to opportunity. Each region offers something truly unique, both in its location, its culture, and however, each really is a really great experience. You'll soon hear from our team in Alice Springs, and they'll speak to their amazing programme and their really special town. What happens after you apply? So your application is received and checked that it's complete by our office, the Office of the Chief Nursing Midwifery Officer, and if anything's missing, you'll be notified and your application will be placed on hold. Then your nominated referees will be contacted. Again, please ensure they're both appropriate and aware that they will be contacted. This will really delay your application if we don't hear back from them. Once your referees have been finalised, your complete application then will be assessed by a panel. And once the panel assesses you successfully, you'll be sent a conditional letter of offer, again, with those key timelines that are outlined on the website. Once you happily accept your new life in the NT, we'll hand you over to our wonderful graduate educators in your chosen region. And then they will contact you to discuss intake dates and preferences and all those pre-employment checks that's required, such as police checks, working with children, etc. So before I hand you over to our central team, here are the links to the Graduate Nurse Midwifery internet page that has all the information that you need. It's a new page, so you'll see it's all nursing midwifery. Just scroll down to the graduate programme component and there's a link to a new PDF there. Next week, the application button to actually apply will be live on that page. We also have the NT Health Nursing Midwifery Facebook group where you can join and keep up to date with education and employment opportunities with NT Health. We really look forward to receiving your application and welcoming you to the NT. Thank you to Flinders for having us here today, and we love to see our Flinders students come to placement, start as grads, and know so many amazing NT Health nurses and midwives working right across and throughout all levels of the organisation who started their journey with Flinders. I'll now hand you over to Emma and Nate. Thank you very much, everyone.
Hello, can I just check that you can hear us? Yes, okay. I'll ask you to flick through the slides if that's all right, Evelyn, Michelle. Hello, oh, sorry, I'll go back. So I'm Emma, and this is Janita or Neets. So we are part of the graduate education team here in Alice Springs. We do have a couple other members that you can see on the screen here who are part of our student facilitation team. So we're a pretty small little team, and as Michelle said, usually once you have received a conditional offer from Darwin, if you have selected Alice Springs as a location, your application then passes down to us, and then we would discuss rotations or intake preferences. So we've both been working here for, I think, at least 5 years for me, 10 years for Neets, and absolutely love it. It's a beautiful hospital, and we have lots of people that actually do placements here as Flinders students and return as graduates. So very happy to be talking to you all today. Next slide, please. So we have run a 12-month program, which is the same across the NT. We don't do 12-month programs in one area, so we do split rotations. You'll do 6 months in one area and 6 months in another. We offer this on a full-time or a part-time basis, depending on your preference. NT Health does offer salary packaging, and a starting salary of over $80,000, which does not include penalties or overtime. There's retention incentives for Alice Springs, so we are one of the more remote locations, so some great incentives for being here, as well as relocation allowance to assist you with moving here. So our program includes clinical support from us. We are available all day, every week, to assist you within the hospital. As well as organising your study days, debrief sessions and case study presentations throughout the year. So lots of interaction from us. Within the employment, you are eligible for up to 7 weeks of annual leave, which is great. And there is accommodation available on site or near the hospital for the first 6 months of your program. Next, please. So these are all of our rotations that we offer. To graduates, of course, not guaranteed, but we do place graduates in all of these areas, so plenty to choose from. Our hospital's over 200 beds, huge range of experience across the board, and we service a large catchment of patients from all around. As Michelle said, many people are flown in or travel from remote communities, so we have people from all around, and can be very busy and a great challenge to start off your career. Next, please. Questions? Michelle gave a wonderful talk. I can see one question there from Geeta in the chat regarding getting references from different placements. Michelle did mention ideally a reference from different placements would be better. And then we can sort of get a gauge of your experience and capabilities from a different, a different ward or clinical area. You might have a reference from a second year and a third year. So references from different years would be preferred. Yes, we do provide sponsorship for international students, as long as as Michelle said, as long as you've got a current application. And then we process a graduate visa. So we do have graduates on visas. One midwifery.
Yes, that is correct. We only take, we have a separate midwifery team, but they only have the one intake for the year.
I'll just jump in there about that. That's the Alice Springs. So there is midwifery places available in both Alice and in Darwin this year.
Will we get a call? Is application needed for a visa? It's going to finish in May or September. Yes, so you would need is that correct, Michelle? You would need a current visa application.
Yes, so it still applies. So what I would encourage anyone, but in your application, but in your current visa, and then we will contact you to let you know if your visa is sufficient for that program, if it's sufficient to start on, and you may need to update it later on. So don't let your visa status stop you applying, but in your application, and then we will support you through what needs to happen with your visa. because it is a moving feast, those ones. So even if you're on a student visa 500, with that limited working rights that you have, if you are successful and offered a place, if you're able to provide us with a letter of completion from your university, that overrides that component and you are able to start in a full-time capacity. Lizzie, yes, there is a different accommodation support. I might let the team in Central speak to what they offer there.
Yeah, so all of our graduates on commencement are guaranteed a 6-month position in our shared, I guess, accommodation. So that's on campus, and it's sort of dormitory style living. So it's you get your own bedroom and then shared kitchen and bathroom, but that's 1 minute into the hospital, you're on site. And then there are another couple options of more apartment style, which are often reserved for couples or families. They're not on campus, but they're very close to the hospital, and they're kind of, offered on an availability basis. So they're a bit more expensive, and if they're available and you've got a partner, then that's something we can look into. But yes, 6 months you're entitled to accommodation.
Good to know. And whilst we wait for more questions, here's one from me. So you mentioned the values of NT Health. So, how can students demonstrate, that their alignment with those values?
Do you want me to take that one? Yeah. So in their cover letter. Sorry. That happens when you're either side of the territory. And you can jump in on this as well. So really it is in your cover letter just speaking to those values, which are safe, responsive, kind, and anyone who's done a placement in the NT, I hope will see that they really are our core values and what we bring to our patients, to each other, to our teams every day. So again, it's just reflecting that in their cover letter to say where they've experienced it, that they understand it. Again, it does not need to be War and Peace. It can just be a comment about how they've done that in their practice, in their placements, that they understand it. Neitz or Emma, would you have anything further to add to that?
I would agree with that. Yeah, and we often see that as well, exampled through the feedback on your clinical placement reports, following safety in terms of following guidelines and responding to patients' needs, kindness, compassion. Yeah, so even just a line in your cover letter of how you have demonstrated that or feel that you demonstrate that, but we often get a good read of that through your placement report. So very important on those clinical rotations.
Yeah. Well, we've got another question here. Do you still have the 2-year nurse grad program that includes rotations with the Aboriginal Congress-led facilities?
We don't run that through NT Health, so that is separate through Congress. So it's a different application process. It's a different graduate program, but they run a 2-year program, which includes a 6-month acute rotation through the hospital.
And Letitia, I can speak to that, the priority question as well. So in terms of our priority groupings, our first group is our Aboriginal First Nations applicants, and then our NT Health, Health if you're a Ruson or Rusom, and NT people who are living here. Sorry, my words are gone today. And then very much our interstate. But if you have done a placement and you are an interstate applicant, absolutely that will hold you in good stead for those preferences, for those intakes. We love people who return and get the NT and want to be here. So your application is based on merit. So on that application, but definitely maybe in your priority in terms of your preference and intakes, that will hold you in good stead.
Okay, so we think we might have another question, and then we'll be welcoming SA Health. Do you prioritise students who've had placements in the NT?
Yes, so just as I said, so if you are an interstate person who has done placements in the NT, absolutely, your application is based on merit and what you've provided. So it's not necessarily that you'll be prioritised because you've done a placement in the NT, but once that application is successful and you're handed over to the grad teams, they will look at that, and that will definitely hold you in good stead in terms of your priority intakes.
Okay, thanks for that question. Okay, well, if there's no further questions, okay, yep, we just had one come in. I'll have a placement in the Northern Territory in August. Would it be better to apply after I complete it?
Lizzie, no, so really what we want in your application, as long as you've done a final year placement, at least one final year placement, you can apply. But if you wanted to wait until after you've done that placement, you can do that as well. But as long as you've got one final year placement, you can apply.
That's wonderful to know. Well, look, Michelle and Janita and team, thank you so much for your presentation on Northern Territory Alice Springs. So we're delighted to have you join us today. We certainly,
Thank you very much.
Yeah, we're getting quite an amazing overview of all of these incredible opportunities. So
and
we're
good
ready
luck,
now.
everyone, with your final placements and application process. Maybe we'll see some of you here.
Wonderful. Thank you so
Thanks
much.
for having us.
Thank you. Best of luck. Thank you. Bye.
Bye.
Bye. Well, we're ready now to welcome Team SA Health. I know there's a number of you. You are welcome to proceed, share your screen and introduce yourselves. Thanks for joining us, SA Health.
Good morning, everyone. My name's Stacey. I will kick us off if we're happy with that. Sounds like we'll just get straight into it. Is that right?
Absolutely. Please proceed.
Excellent. All right. Now I'm just going to share our presentation. All right. Now, as I said, my name's Stacey. I'm Principal Workforce Consultant in Workforce Services in the Department of Health and Wellbeing. And I am here today with lots of our nurse and midwifery educators and TPPP coordinators. So we're all going to take some time to speak to you and explain what a TPPP in nursing or midwifery looks like across SA Health. And there will be some time for questions for you at the end. So this first slide talks about what you can expect to hear from us today. So like I said, there's a broad range of us here today, and we will take you through various different aspects of like a roadmap of what you can expect from a TPPP in SA Health, what the differences might be in a TPPP in metro versus regional and remote areas of South Australia, some specialised TPPP positions that we offer that you might not be aware of, and then I'll speak to you about the application process and different aspects of that and some hints and tips along the way. So now I'm going to drive the presentation, and then there'll be lots of my colleagues who will speak. So please bear with us as we work through that. But I will do my best to keep up with everyone. So first we're moving to Zoe, I believe.
Thank you, Stacey. So my name's Zoe Coleman. I'm the Early Career Nurse Educator for the Northern Adelaide Local Health Network. It's a pleasure to speak to you all today and talk to you a bit about what's offered at SA Health. So I'll get you to go to the roadmap, Stacey. Thank you. So this one is just looking at the roadmap of bringing our new graduates into the workforce and how that support looks like. So just be aware, in South Australia, each network will have their own intricacies and differences, but all of the networks are actually delivering the same requirements of a statewide program through SA Health, which has been contextualised to each network. The information is generalised, and if you'd like further information about each individual network that's offering a TPPP in SA Health, you can attend the relevant information being offered, which we do host on site or online as well, so you can get that individual information from the SA Health TPPP website. So onboarding, some of the real important things to be aware about is your timeframes and making sure that your pre-employment documentation is provided within the timeframe that's been recommended by your employer of the network that you have been offered. It could jeopardise your position and result in a withdrawal of offer if you're not ready to go by the time you've been allocated to start your TPPP. You will receive a hospital orientation and some supernumerary time where you'll get to work with a buddy nurse. So you kind of have that nice transition of working with somebody who's registered while you get used to the clinical area. You'll have professional development days, which may be face-to-face or online, depending if you're in Metro or regional South Australia. You'll also be invited to participate in learning modules online, and some of these could be prerequisites into some further learning or face-to-face workshops, or built into those workshops that you'll be attending. So new nurses will be supported by a lovely team. Each network has got their own team based just to look after our TPPP. So you'll have your coordinators and also your level 2 support, which will be your clinical nurses that are on the floor working at the bedside, elbow to elbow, that will support you through any clinical issues that you may need, and they'll be on call for you as well. But each network or each hospital does have their own timeframes that they'll be available to you. You'll also be allocated a preceptor. So that preceptor is somebody who works on your board who will actually help you to achieve those clinical objectives that you'll set during your TPPP. And there'll be things that you want to work on during your TPPP that you've identified as areas that are important to you or important to practice while you're bringing that theory to practice over from student to registered nurse. And you'll also be asked to complete a performance review and development, which will all be included in the same conversations that you're having with your managers and your preceptors. It helps you to understand where you're at in terms of your development, and it also helps your managers and preceptors to know how much support you may need, or if you need any kind of critical support at that time, they'll be there for you. So during the program, you can expect that this is going to be it's constantly looked at to see how we can improve and do better every year. So it's redesigned every year. It's contemporary. It's evidence-based, capability measured in the TPPP. So it's a very much so a team effort to bring this program together with lots of influence from all of our key stakeholders. We invest in strengthening the program every year. And as I said, that continuous evaluation of the program that informs future development. We want to build a workforce for the future. So we want to start at those real foundational skills, building that knowledge and experience that you can build on through the years. And you've got opportunities to explore lots of different clinical specialties within SA Health as well. So some of the highlights of the journey or the program is working with your peers, networking, the camaraderie, building those friendships. SA Health is a really well-regarded program. It's evidence-based, and as I said, a really exciting range of rotations that you can choose from, lots of diversity, and entering into the public sector does give you the flexibility to move around to different networks. Being under the SA Health banner, we've got all networks where you can actually take your entitlements with you that you've built up in your annual leave and your sick leave, that you can move around within SA Health if you choose to move networks as well, or choose to go somewhere else after your TPPP. And within SA Health, it's very exciting. We have got multiple networks this year that are offering ongoing employment as well. So look further into that when you're looking at the different networks on the website. There is definitely that opportunity for ongoing or casual positions after your TPPP as well with most networks. Happy for the next one.
Oops, sorry.
It's okay. Are we frozen?
Is that, are we, oops, sorry.
That's okay. I thought it was me.
No, that's all right. Are you okay to continue to talk through the Metro? Yeah, thank you.
No problems.
Excellent. All right. Now, it looks like my presentation is all right, but is everything okay at your end?
I just can't see the next slide, but that's okay. I can keep talking about the Metro opportunities. I just haven't seen that on our presentation.
Okay.
To the next slide. Yeah.
Seems to have frozen, Stacey.
Sorry.
Yeah, no, that's okay.
Sorry.
That's okay. I did want to spend some time talking about the opportunities that will be available to you as a graduate nurse or midwife in metropolitan South Australia as well. And hopefully we can get clicking on to the next one.
I'll just stop sharing and then reshare it. So if you want to keep going, Zoe, and then I'll try and do this in the background.
Yep, no problem.
Let me know if you want me to share it as well.
Thank you.
Thanks, everyone. Sorry for that. Technology is great when it's working. So in metropolitan South Australia, we've got a different range of networks that you are able to apply for during your TPPP. So that includes the Central, Southern, Northern and Women's and Children's Network. Oh, awesome. There you go, Stace. That's working. I'm actually at the next map one now, if you're happy to flick. So when we hop onto the map, yeah, I can't see the map yet, but that's okay.
Sorry.
Okay, it's all good. All good.
It is showing at my end, so I'm really sorry, everyone. I might stop sharing, and if you keep going, Zoe, and then
there we go. It's up now.
Oh, it's working. All right. It just takes for us to give up on it to click in.
It's all good. Thanks, everyone, for your patience. So the Central Adelaide Local Health Network is everything's an abbreviation as Help in Health, as we all know. So we call it CARLIN. So CARLIN covers the Central Metro region, as you can see there in the green on the map, and the Southern Adelaide Local Health Network, or SARLIN, covers the southern suburbs. So that's all that purple area, as you can see there, kind of also down the coast. And the Northern Adelaide Local Health Network, or NARLN, where I work, is the northern and northeast suburbs. So as you can see, that's up there a little bit towards north, just central of the higher than Carlin. So the Women's and Children's Network is actually a statewide service. So their headquarters are at the Women's and Children's Hospital in the Adelaide city, but they actually do provide a statewide service specialising in care for children, youth and women. So lots of opportunity at those different networks. And I'll talk to you a little bit about those individual services as well. If we can hop to the next one, please, Stacey.
Of course. Right. Did that work? Can you see that?
Not yet, but we know it's going to. I think there probably is a bit of a lag. That's okay. There we go. Thank you. So CARLIN, or our central network, the major facility is the Royal Adelaide Hospital, the Queen Elizabeth Hospital, Hampstead Rehab as well. Mental health services, they also look after our South Australian Prison Service, medical imaging and the statewide rehabilitation service. So that is your central opportunities there. Our southern network includes the Flinders Medical Centre, Noarlunga Hospital, the Repat Health Precinct, DASA and Jamie Lancombe Centre at Glenside, GP Plus centres and super clinics, providing care from birth all the way through to end of life. And NARLN, or the Northern Adelaide Local Health Network, our major facilities include the Lyell McEwen Hospital, Modbury Hospital, Northern Mental Health Services. We also have GP Plus health centres and super clinics and subacute services. And the Women's and Children's Hospital, or WICHN, they span over 150 community-based sites with 7 statewide health services, and WICHN care for children with acute and chronic conditions in South Australia and are the largest maternity and obstetric service. So as you can see, lots of different opportunities there. So you'll be able to see those preferences when you apply through SA Health, if that's something you're interested in. And I will share with you the next slide, which is a video that is a TPPP experience from one of our NARLN graduates. Her name is Sherry, and Sherry was one of our finalists at this year's Nursing and Midwifery Excellence Awards, and we're very proud of Sherry and her journey, and we would really love to share that with you when it happens.
All right, I'm going to play. I'll just ask the facilitators if you could just let us know if you can't hear this. It should work.
Can see it, but no audio, Stacey.
Okay.
Would you like me to have a go at?
Yeah, if you would.
Yeah.
If you like, I will try it one more time like this. Can you hear that? No? All right. It doesn't seem like you can hear the video, which is a real shame. What I might ask Alyssa to share her screen.
Can you now see that sharing?
Yeah, we can, if you'd like to share.
Everyone needs to cross their fingers for audio now.
So currently I work in MAPU. That is a small ward that is a transition from AD to the ward. I like helping people, and being able to help others give me a sense of achievement, happiness, and personal value.
Sherry's honestly one of the most beautiful nurses I've come across. She's been a pleasure to work with. She advocates for safety and her patients, and it provides amazing person-centred care.
The thing that we've noticed most about Sherry is that it wasn't just good enough to do the basics, she wanted to be better every time. I always come back to, would I be happy for someone to care for my parents? And every time I would be happy if I turned up and Sherry was looking after my family, because I know that she would give them the safest, most effective care.
At the end of the TPPP, I'm able to look after patients, take students, and also I feel like I can advocate for my patients as well. I'm just proud of what I'm doing now, and I never give up and keep improving.
Thank you, Alyssa. So as you can see, it's such a journey of growth, and we're really supportive in SA Health of you going through that journey, and very proud of all our graduates. So I'll now hand over to Alyssa and Steph, who are representing rural and remote networks in South Australia.
Thanks, Zoe. I'm Steph. I'm the TPPP nurse educator for Barossa Hills Fleurieu. Alyssa, you just might want to... Yeah, thanks. I am co-presenting for Regional this morning with Alyssa, and we are just going to take you through some of the opportunities Regional South Australia has to offer, which are just incredible. So the Regional South Australia population in the last census, which was a little while ago now, but there was over 400,000 regional addresses for South Australia. We have 6 regional LHNs within SA Health, and they provide services to over 63 sites. Plus there's outreach services on top of that as well, which service our very remote populations. Thanks, Alyssa. In 2025, we had more than 1,500 applications for the nursing TPPP for SA Health, but that also means that many people actually missed out on an opportunity to have that supported year. The 3 big metro LHNs offered over 600 positions for our TPPPs, and one of the metro LHNs received 350 first preference nominations alone. While some of our regional LHNs, we still had vacancies, so we didn't have quite as many people popping us as first preference, which is a little sad. And we love to have our TPPPs come out and experience what regional has to offer. But we offer not only meaningful supported 12-month programs, but those programs that offer consolidation and the opportunity to acquire new skills in the communities that really value our care. And we've heard it a lot before. We've heard people say that they feel that regional LHNs have a limited career. A lot of it is aged care. It can be really stressful. It can be slow. It can be lonely. It can be quiet. Same thing every day. Really boring. I'm going to say we're here to debunk some of those myths. And I'm really hoping that after our presentation today, you'll have a little bit more, give it a little bit more thought, and think about moving outside of the metropolitan area and the comfort zone. We do have really good, Australia Post's pretty good these days, and you can get most things in regional South Australia that you can in metro. It might just take a little while to get there by post. So next slide, please, Alyssa. And we have got a short video.
You got Portia, you know the deal. Hey, hope you've settled into the new job. Call me back.
We just hope you're making some friends up there, love.
Thanks, Alyssa. So these are some of the faces of our nursing midwifery TPPP participants we've had in our regional areas. Some of the people have grown up and have family or are part of the community in the sites that they now work. However, some of these people have also relocated from Adelaide, from another area of rural South Australia, or from interstate to experience the lifestyle of regional South Australia, which, as we can see from that last short video, there's some really great elements to that, being able to pop out and go surfing after work before and late, catch some waves. Some great opportunities out there, but nursing and midwifery in rural and regional areas is diverse and rewarding. There's opportunities that exist that include a career in acute, there's Aboriginal health, aged care, community health, emergency, high acuity. There's mental health, midwifery, oncology services, perioperative, renal services, rehabilitation. I'm going to say that's probably they're quite big, broad brush strokes of services that are available, and there's lots of layers underneath of those. Yeah, thanks, Alyssa. The life of a rural registered nurse is exciting. The rural experience provides us with an opportunity to work to our full scope of practice, with many of our registered nurses being competent and capable with blood taking, cannulation within that first 6 to 9 months of being in the program. There's also then opportunities to work with nurses in the regional sites that work to a more extended scope of practice, which includes advanced wound closure, many of the more outside of BHF, but more regional areas. They will support you to obtain an X-ray licence, and casting for non-complex fractures is just to name a few of those extended scope capabilities that you can gain. The skills and exposure to high-level time management as well. So with our hospital teams needing to be really responsive to what happens within our own sites and smaller teams availability, you might be at a site with a small ED and have sort of 5 or 10 patients walk in the door, all come through the door one after the other in a very short period of time. And it's up to you and the team that are on site to be able to triage and prioritise and care for those patients while you're also caring for the patients that you already had in your hospital site or facility. Alternatively, you might be in a site where you've got birthing services and your birthing suite might already have a lady in there. And then all of a sudden you've got another woman who's presented that needs some support with midwifery care. So working with your midwife buddy to work through how you might manage that and how the team can support you with that. And it really is working in rural and remote and regional sites is really very much about the team and the team working together to provide that high level of care. Our regional TPPPs, once they've finished their graduate year, are quite sought after, especially once you've gathered so many broad skills and consolidated. And our sites offer everything from paediatrics and through to palliative care and end-of-life care and care of the older person. So not every service is available in every site, so I do encourage you to make sure that you research on the SA Health website what services are available in those sites before you make any decisions. But we do provide services across the lifespan on a daily basis. I'm going to hand over to Alyssa because the opportunities are endless in regional.
Thank you very much, Steph. Let's see how we go with me navigating the IT and talking, hey? Was it rubbing your belly and patting your head? That's okay, we'll make this work. Okay, thank you everyone. My name's Alyssa Bailey. I'm the Nursing Director for Education and Workforce based here in Erin Far North. I'm on beautiful Bungala land, which is I'm based in Port Lincoln. I am a Flinders Uni alumni, and I do not feel comfortable sharing what year I graduated, but love being here today and presenting to you all. So, as we mentioned, there are endless opportunities available in regional SA, but we are really dedicated to supporting you during your TPPP nursing or midwifery journey. There are many ways in which we support you, and some of them are listed on screen. We do have regional dedicated education teams that have both nurse and midwifery educators, facilitators. Some sites have dedicated preceptor teams, but as Steph has already mentioned, it really is all about the team. It takes a team and a whole site to support a TPPP. I spoke to one of my graduates from last year only a week ago, and she said that the support that she was provided at her site came from everyone. There was one particular person that she was very surprised about that supported her, and it was the cleaner. The cleaner was always the one that came and checked on her to make sure that she was going okay. And that was pretty special to just know that it really does consolidate the fact that it does take everyone to support you during that transition journey. Educational opportunities available through the TPPP, so most of the LHNs, as Zoe mentioned before, we have a statewide program that's evidence-based. The professional development days might have slight variances within networks, but essentially around 10 study days are supported within each of the programs. I can talk to my network in Erin Far North. Those professional development days are offered in 2 very separate locations, allowing our TPPPs an opportunity to experience different areas of our network. The e-name program is 3 of the days that are included in regional. You don't receive that opportunity in metro. So e-name stands for Emergency Nursing and Midwifery Education. We do that at a varying time, and it prepares you for you to get into the emergency departments and allows you that opportunity to build your skills and confidence prior to stepping past that 6 months post-graduation. I'm just going to play a short video and hopefully the audio works. We don't want any more IT issues.
The York and Northern Nursing Midwifery Education team works across all 17 of our sites in York and Northern to support our newly graduated nurses and midwives, and also our enrolled nurse cadets and all of our nursing students and midwifery students that work in our network.
We have a really key team of level 2s who are our clinical-based facilitators. They work at the elbow point with our students and with our graduate nurses and support them in developing that role modelling and what it actually means to be a nurse. Like, how do you put that into practice instead of reading it from a piece of paper? Then we have the level 3s and myself. We do lots of the more overarching type education. And as a team, it's very much what our focus and our collective process is to make people feel stronger and safe at work.
So success means building those relationships between the sites, the consumers and also the graduates. But real success is when we see those people go on and succeed in their career and are able to reflect back, and some of them come back into the education space themselves.
I'm passionate because it's about ensuring we give really good quality service and care to our consumers in our communities across York and Northern.
So living and working regionally looks different depending on where you go, but some of the things that people don't often associate with moving outside of the metro area is simple things like avoiding the crazy commute to work. You don't have to fight to get a car park. There's no 45-minute drives one way. I live in Port Lincoln, takes me 6 minutes, and I live out of town to get to my workplace. The regional communities, they know who you are. They really want to support you. You're an embraced member of our community, and they're here to basically embrace you. They know it's hard to recruit in some areas for nursing and midwifery. You really make a difference. Why not
come to a new place and be a tourist in the place that you live. We've got some beautiful areas within inland and coastal South Australia. Obviously, the rural pay incentives, which I'll discuss a little bit more in a minute, is also another added perk of coming to do your TPPP in regional South Australia. Just some considerations and some tips before I hand over is one of the things that we really need to ensure is that when you're considering a regional TPPP, you need to have an Australian driver's licence and a reliable car. That's something that we really ensure for you and your safety. Remembering that you're working shift work and it allows you an opportunity to get out and see the areas that you live. We challenge you to be brave and step outside of your comfort zone. Many participants who undertake the program that have relocated, they don't have regrets. We've got lots of TPPPs that came for 12 months and 5-6 years later their mum and dad have moved and they've really embedded themselves within our community and they call our regional LHNs home. Isolation can be a challenge. However, we really find that it doesn't take long for you to find your people within these regional towns. There's lots of opportunities to establish yourself, including country sport, which we all know is very important within our country areas, but there are also other social opportunities that you'll have, including things like YTAP and various other opportunities such as orienteering. We acknowledge the challenges that are sometimes faced with the rental market. We are seeing that across the state. Actually, we're probably seeing it nationally, if I'm completely honest. Regional sites really, we do encourage TPPPs to look around. Some regional sites do have the opportunity to provide some short-term accommodation to support you if you were to move, but that is on an individual basis. There is criteria that applies for that, and I really encourage you to reach out to the regional LHN to see what is available before you obviously commit to anything. We all encourage you to think beyond your TPPP as well, with many opportunities for you once you finish your program to look at advanced scope, which Steph has already talked about today. I actually met with the TPPP from 2024 cohort. I bumped into her in Port Lincoln and she advised me that she's not only completed her suturing course, which is allowing her to suture simple wounds within a community without the presence of a medical officer, but she's also completed her X-ray course, so able to take films and care for people in her community with simple fractures. She's also undertaking her advanced diploma in emergency nursing, and she's absolutely loving her decision to come out to regional South Australia. Let's talk quickly about the money, because let's face it, that's the best thing about being a TPPP is you finally get paid. There are multiple incentives, financial incentives about coming out to regional South Australia. I won't be able to quote you on figures, but they are aligned with REA. So we're talking about things like relocation and zone allowance. SA Health also offer relocation support. If you would like to know more information about that, you are free to visit the SA Health website, and eligibility criteria do apply for that. If you want to know more about any of the details that we've shared with you today regarding regional or remote TPPP opportunities, I really encourage you to reach out and come to one of the many information sessions that are available for nursing and midwifery.
I went to university straight after high school, did my Bachelor of Nursing at Flinders University, and then was offered a TPPP program here at Cleve. I really value communication. I think having good communication with patients means you're able to understand their needs and then you can advocate for them really well.
Bedside handover has been a challenge to a lot of hospitals in our state, and I got Kiana on board and asked her to be the bedside champion, and she did a great job of it. She led by example as a junior RN and ensured that it happened at our site, which improves the patient and resident journey.
I've had a lot of comments of other nurses saying you wouldn't even know she was a TPPP. She's just got that confidence, she's got that natural ability, she's so caring. To be a patient cared for by Kiana, I think you'd feel really safe and comfortable.
I love how nursing has so many opportunities available, especially rural nursing, so I hope to do my X-ray course and suturing course. I'm really inspired by making a difference in someone's life, no matter how big or small, and I really hope to have a positive impact on everyone that I encounter.
So Kiana rolled the dice, never been to Cleve, never been to Erin Far North before, and she took up her TPPP opportunity. She's absolutely flourishing in regional LHNs and really values her time here, has now bought a house and has relocated with her partner. So I hope that during this presentation, Steph and I have been able to challenge your thinking. So regional and remote nursing it's actually exciting. It's very challenging. It's very rewarding. There are multiple career opportunities. You have the opportunity to specialise in advanced scope and other areas. It is family-based and very person-centred. So we hope that we will see your application for a TPPP, and we hope that you will consider preferencing one of the 63 sites across regional and remote SA. Good luck to everyone, and I will now pass back to Stacey.
Thank you, Alyssa. Now we're now going to talk about midwifery, but I believe Kate, who is our midwifery educator, has had to go off.
Oh, no, I'm still here.
Oh, no, I'm still here. Excellent.
I've got
wonderful.
10 minutes.
Thanks, Kate. All right, the floor is yours.
Perfect. Thanks, everyone. Appreciate your patience with all of the IT issues, but we've made it. So good morning. And first, I want to actually congratulate you all. You're really close and to becoming registered midwives and stepping into probably one of the most rewarding but challenging and privileged professions that there is. I guess today I want to talk to you about something that most of you don't always consider at first, and that's regional midwifery. So I guess most people, when they think about starting their careers, they often choose or think about only metro places, the tertiary centres and, you know, the busy life in the city. But I guess what I really want to highlight to you today is that some of the biggest opportunities for growth, for learning, connection and career satisfaction can actually come from small towns and regional communities. In the regional maternity services, you are never just a grad. You become part of the team, you become part of the community, and you do that really quickly. And also, you know, following on from that, you become a capable, adaptable and highly skilled midwife in your own right. Regional midwifery gives you a greater continuity and relationship-based care, broad clinical exposure and skill development. For example, our grads, if they want to, can finish the year with cannulation, with water birth accreditation, with suturing and ultrasound accreditation, just to name a few things. You have increased autonomy and confidence in your skills. We have diverse experiences across the full scope of midwifery. We have a strong mentoring and team cultures in all of our regions, and we have opportunities to make a genuine impact in women's lives, and that's what we did all the course for, right? So in regional services, midwives wear many hats. You don't just become skilled in one area, you become adaptable, you're resourceful and clinically confident across the entire midwifery journey. Can we jump to the next slide? This is Billy. She was one of our grads last year and she was nominated and actually won the Early Career Midwifery Award this year.
I'm a registered midwife, currently working at Mount Barker. I did my TPPP last year, so I completed 8 months on Kangaroo Island and then came back to Mount Barker for my last 4 months. Looking back, it's definitely shaped me as a midwife. I think because it's a continuity model, so you see the women through their whole pregnancy, you see them for their birth, and then after birth, you see them for 6 weeks. I think it just gives you that opportunity to build them really trusting relationships, and the women over there just appreciate being able to birth on island.
Billy has an incredible attitude. She takes on any tasks. She's really quite inspirational. She's friendly, she's kind, she's an advocate for women and women-centred care.
I love being a midwife, like full stop. I think that there's a great privilege to being a midwife and the trust that the women have in you and the relationships that they build, and I'm just thankful that every day I can come to work and the women trust me to care for them and their babies.
Great. Just to finish off, apologies, I'm kind of flying through this. What support looks like for a grad, a midwifery grad. You have dedicated educators and facilitators. We have clinical midwifery facilitators available out at Barossa Hills. We have supernumerary learning time. We have skill workshops, peer support and regular check-ins. One of the biggest strengths of regional programs is the team culture. So people know you, my battery's running low, people support you and people genuinely want to succeed. So, and in closing, all I want you to take away from this is really be open to it. So even if regional wasn't your first choice, have a think about it. Join us in our individual LHNs where we can talk about the midwifery in more detail, and we look forward to meeting you all. Thanks.
Thank you so much, Kate. And yes, just to reiterate what Kate said about the individual LHN information sessions. So there's individual web tiles for each of our local health networks. And on those web tiles, you'll find information about the sites, but also there'll be information if you scroll to the bottom, if the LHN is holding an information session. So they might be held virtually or in person. And so please do explore that with the LHNs that you are interested at working at, because you'll have an opportunity to ask more individualised questions and find out more about those specific sites and rotations available. So now we are going to talk about specialised TPPP opportunities that are available across SA Health. There are three different types of specialisation, but first we're going to speak about aged and community care, and I'll ask Lisa to talk to that.
Thanks, Stacey, and thank you everyone for having me today. My name's Lisa Fidog and I'm the Director of Nursing Care of the Older Person for Barossa Hills Fleurieu. Barossa Hills Fleurieu has 249 aged care residential beds across 6 sites stretching from Kapunda and Yadanda to Kangaroo Island. However, we have many aged care beds throughout our regional networks across the state. Today, I'd like to talk about my nursing journey a little bit, which links in with what Steph and Alyssa were talking about as well. So when I completed my degree at the University of South Australia, I moved up from Adelaide to Port Augusta for my graduate year. Moving from Adelaide to a regional site ended up changing my life. I experienced nursing in a setting I had never previously considered as a career path. I met my husband, just by the way, and I quickly fell in love with nursing in regional settings, and it's where I continue to work today. Throughout my career in various regional settings and hospitals, I have worked in theatre, recovery, day surgery, high dependency units, acute medical and surgical wards, paediatrics and accident and emergency, and I've even assisted with a few births here and there. I loved the fast pace of acute nursing in a regional setting, and I was that nurse running toward the patient needing a retrieval. However, in 2018, while working at the Kapunda Hospital, I was asked to backfill the nurse unit manager role at the Kapunda Homes. I had not done a great deal of aged care previously. Some of the sites I had worked at did have aged care, but it was definitely not my specialty. As I had been a nurse unit manager before, I agreed, thinking that I would be there for 6 weeks. I ended up staying for 6 years and obviously progressed my career in the aged care specialty. So the question is why? Why did a very acute focused nurse progress into aged care? Aged care is unlike any other specialty in nursing. In aged care, you may care for the same person for years rather than days or months. You develop relationships with the residents where you truly get to know them and they get to know you. You are not only caring for one person, you care for the whole family. Families come to you with their concerns, maybe about the resident, but also maybe about something that's happening in their own lives. You become a safe and trusted person. It is a real privilege. Aged care has come a long way, especially since the Royal Commission to Aged Care Quality and Safety handed down its findings in 2021. There were clear recommendations around clinical care, dementia care, food and nutrition, governance and diversity. It is now recognised in legislation that residents have rights, including the right to independence, empowerment, freedom of choice, respect, privacy of information, person-centred care, and the ability to raise a concern without reprisal. Working in aged care brings a great sense of accountability, but also an enormous sense of accomplishment and reward. So what are the skills you will continue to develop as a registered nurse working in aged care? So we can talk about medication management, ensuring medications are administered safely, documentation is accurate, medications are reviewed as required. This includes the management of antipsychotic and psychotropic medications, as well as IV medications and fluids, IM medications and subcutaneous medications within our aged care sites. Clinical assessments are pivotal in aged care. They are similar to the observations performed in acute settings. However, they also recognise subtle changes in residents' conditions that may indicate that something is not quite right. This may range from noticing small behavioural or physical changes to a resident who may be experiencing a neurological event, or maybe it's looking after a resident post-fall. The better you know your residents, the easier it becomes to recognise early signs of deterioration or change from their baseline. Care planning plays a big role in aged care. So comprehensive care planning allows residents' choices and preferences to be identified and documented, while ensuring registered nurses, enrolled nurses, care staff and allied health professionals all have the information they need to deliver safe, person-centred care. So providing person-centred care means that in aged care we deliver holistic care. It takes into consideration residents' needs, preferences, values and goals, rather than focusing solely on a disease process or medical condition. Finally, being part of a team. Working in aged care means working alongside nurses, carers, leisure and lifestyle staff, allied health professionals who have chosen to care for some of our most vulnerable people in our healthcare setting. The team shares a common goal, ensuring the best possible quality of life for all residents. So in closing, I encourage you to keep an open mind about where your nursing career may take you. I never imagined that aged care would become my passion, but it has provided me with some of the most rewarding and meaningful experiences of my career. Aged care nursing is about so much more than caring for older people. It is about building relationships, advocating for dignity and choice, supporting families, and making a genuine difference in someone's quality of life every single day. It challenges you clinically, emotionally, and professionally, while also giving you the opportunity to truly know the people that you are caring for. As our population continues to grow and age, the need for skilled, compassionate nurses in aged care has never been greater. I hope that hearing a little bit about my journey today encourages you to consider aged care as part of your own nursing future. You may be surprised, just as I was, about how rewarding it can be. Thanks, Stacey.
Thank you so much, Lisa. It's so wonderful to hear your own experience, and I hope that everybody has taken away some really important information about working in aged care and transitioning. So thank you so much for that. So aged care opportunities are available at Limestone Coast, Flinders and Upper North, Air Far North, Barossa Hills and York and Northern local health networks. But in addition, there's also two other specialisations that we've spoken about, combined research TPPP. So that is an opportunity for candidates to undertake a research honours with Flinders University. And so that's something that you would need to be eligible for in terms of the Flinders University eligibility criteria to the honours program, but you'd be supported through your employment. And then the other, which was introduced last year, is the mental health nursing TPPP. So that's an 18-month program which starts you off with 6 months of acute care, so that you can consolidate your, sorry, not necessarily acute care, acute setting, so you can consolidate your general nursing skills and theory. And then the following 12 months concentrates on specialising in mental health setting, and it includes the completion of the graduate certificate in nursing, mental health nursing through Adelaide University. So I'll talk about preferencing later on, but you will be able to preference either what we call standard TPPP, which is like your usual TPPP general, or you can preference one of these three as well. All right, Alyssa, can we please move to the next slide? Okay, so now I'm going to talk about the application process and what you can expect and what you need to do when you hopefully apply for a position in SA Health. So our application process is centralised, so you only need to apply once. You can apply for up to 3 preferred local health networks, and we encourage you to preference widely so that you will have a better chance of securing a position. So applications will open on the 1st of June, so you've got another week and a bit, and our applications are open for 3 weeks. You can apply online, and we'll be advertising the links, but if you go on the SA Health Careers website, you will see it there. And all the information you need will be there. So there's information within the application form. There's also the TPPP applicant handbook, and also a frequently asked questions section on our website. So we hope that that answers all of your questions. If you need, after you've explored all of those resources and you still have questions, please reach out to us via email. But we do ask that you try and find that information first through those resources where you can. We'll then be looking to make offers from mid-August. So midwives are offered in the first instance, and we aim to make those offers in the middle of August, followed by the first round of nurses in early September. Okay. We also offer only one position in TPPP in South Australia. So if you are offered a position at Carlin and you decline that, you won't be offered another position. All right. Okay, so we really want you to set yourself up to succeed. And what I would love for you to take away from this, and what you'll hear from other presenters today, I heard a little bit of Northern Territory, I think, before us, and it's all in the same vein, in that we really just want you to succeed. We want you to set yourselves up for a successful career and to have some really solid foundations when you're applying for roles. So do your research the LHNs that you want to work in and the rotations that you might want to do. Please look at the web tiles for all the different LHNs, and they are all linked from the same web page where that FAQ and handbook is that I've spoken about. Make sure, this might seem silly, but choose the email that you're going to use to start your application and receive all correspondence to. That might be your uni email, or it might be your private Gmail, but please just choose and stick to it. All communication will be via that email, and if you miss something, it may mean that your application can't progress, or that you might receive an offer and not respond, and then we'll rescind that offer after the set time. So please make sure you're using that one email. And start your application early. So our applications are open for 3 weeks, but we don't want you to start your application on the last day. Okay, there is some information that you'll need to provide throughout your application, and if you don't have that on hand, if you've started your application earlier, you can at least have some time to save your application and go back to it. When we recruit to positions in any capacity, we will always conduct referee checks. And something that is an excellent practice is to make sure you talk to your referees before you nominate them. So if I'm applying for a job and I plan to use Alyssa and Lisa as my referees, I'm going to have a conversation with them first and say, I'm applying for this role, and I'd like to use you as a referee. Can I please do so? And will you be contactable? And what is the best way that they can contact you? So we will contact all referees via email. And another thing to really remember is make sure when you input that email, you input it correctly. So double check that there are no errors, but it's really important that you've had the chat to your referees first so they know what to expect. Preference as widely as you're comfortable with. So the reason we say this is, and Steph spoke to this a little earlier, some LHNs have more positions available than others. And if you preference a smaller LHN that only has 20 positions available, if you only preference that LHN and you're not within the top 20 candidates, then you aren't going to be considered for another position. But if you preference 3 regions, for example, one might be 20, one might be 50, one might be 10, you've then given yourself a 1 in 80 chance of getting a job. So we really encourage you to do that, but we also don't want you to preference a job that you're not willing to take. So if you have no interest in moving to the Limestone Coast, please don't preference there because it's a waste of a preference for you. You're not going to get another offer if you decline it, and it also means that someone else might miss out on the opportunity when they really want to go. I saw a question earlier in the chat about English language. Now, it's not an SA Health requirement for us to confirm your English language skills, but it is an APRA requirement. So we require you to be registered with APRA, and we will need for you to have done everything that APRA requires of you to confirm your English language skills. So please refer to APRA for any queries that you've got about any English language testing that you might need to do. I know that some of you will be exempt from that, but just make sure that you know exactly what's required for your individual circumstances. I know that the exemption is in place for lots of students, but I also know that there are some occasions where the exemption falls away and is no longer applicable. So I would encourage you to check that with APRA. You don't need to provide a copy of your English language testing, but we do ask that you let us know if you are in that category so that we can be aware and we can support you as needed through that onboarding period. Okay. All right, Alyssa, next slide. Thank you. So there are 3 steps to completing your application with SA Health. The first is the online application that I mentioned, and we use a platform called PageUp. Now, if you've applied for a job in SA Health before, then you already would have an account set up and you can just log in. Otherwise, you'll be asked to set up an account and submit some of your personal particulars. Now, the good thing about PageUp and future job applications within SA Health is that once you have applied for one role, all of your information will filter through. So if you are applying for a second or subsequent role, your application will already be commenced for you in terms of your personal details, and then you can add on to that. You can also save your application and go back to it another time. So I would encourage everybody to start your application as early as possible in those first couple of days, and then you'll be best positioned to not be scrambling at the last minute. We will contact your referees and they must provide a response. If we are not getting a response from your referee, then we will follow up with you to touch base with them and, if necessary, to provide alternate referees. There's information on what a valid referee is, a valid clinical referee in the handbook and the frequently asked questions. So please check that. And then the third step is that you'll be required to complete an online interview. All right, so we run our interviews electronically, and that means that you're able to do it at a time that is convenient to you, and you also don't need to travel. So once you've submitted your application, within, say, 2 business days, you'll receive a link to do your online interview. So that's the other advantage of starting your application early. You get more time to do the next step. All right. Now, this is an example of what might be in the handbook. So, and we're just reiterating those dates again. So applications are open on the 1st of June for 3 weeks, and they close on Friday, the 19th of June. You will have some additional time to amend your preferences if you like, and add English language information or other information until the 10th of July. All right. Next slide. Thank you. Now, this slide explains the process for referee checks. What will happen is once you've submitted your application, you'll then be asked to provide the details of your referee checks. And again, just a reminder to ensure the email is correct. And then we will contact them via email. So if your referee asks, well, how will they contact me? Will they ring me? We will contact them via email, and they'll fill in an electronic form, which shouldn't take them long at all to do. So it's all done online. Next slide, please, Alyssa. Thank you. Now, some more information about the online interview. So you'll receive that information, and you'll be provided with prompts to follow to record your interview. A couple of really important points that we want to talk to you about in terms of when you undertake your online interview. We want you to, whilst you'll probably be doing it at home, we want you to really take it seriously and position yourself as best as possible. So make sure that you're comfortable, but also that you're feeling well prepared. So put yourself in a nice, quiet environment. Perhaps you might do it when no one else is home, or you can do it in a quiet room rather than an open space. Wear something that you're comfortable in, but you're also going to feel professional in, because that will be reflected in your responses. I can guarantee you that if you're in your pajamas or you're sitting on your bed, we will be able to tell, and you'll not present yourself in the best way that you possibly can. All right. We also want to talk to you about providing genuine responses. Now, the technology that we use to facilitate the online interviews does detect the use of AI. We can see when you might, if you might detract from a screen, and we won't tolerate it. You need to be professional and have integrity around your responses. And if we suspect that somebody has cheated, we will be disqualifying the applications. So please remember that, and please think about that in your future job applications as well. You want to be putting yourself in the best possible position, and all we want from you is genuine responses. You will provide an excellent response if you think about how you might answer that question based on your experience so far. So please remember that. And please also don't use Bluetooth headphones. And if you have any issues with technology, the platform that we use provide excellent customer service. So they will be able to assist you at any time. We provide some themes on this slide about what you might be asked about. Now, the interview questions, I will say, are not difficult. They are questions that you can, like the themes are things that you will be asked about in lots of different interview settings. And I would encourage you to do some research about how you might best position yourself and what some examples might be that you might be able to call upon that reflect general behavioural interview themes. All right, thank you. This is an example of what the VidCreator platform looks like, just to give you an idea so that you are familiar before you do that. Now, I know that our timeframes can get confusing because we have lots of dates, all right? And we try and make it as clear as possible for you. There's a note on this slide that says your interview must be completed by Monday, the 22nd of June. So what we're going to do is you've got 3 weeks to complete your application, and your application is due on the 19th of June. If you submit your application, which I hope you will, prior to that date, the next steps will kick off, and you will have, so if you complete your application on the 10th of June, you will have from the 10th until the 22nd to complete the referee and the interview steps. But if you complete your application at the last 5 minutes at 4:55 on Friday the 19th, you will only have the Saturday, Sunday and Monday to complete the next steps. So we do give you that buffer because we know that there will be some instances where you need that time. But that's just an example of why you should complete your interview as soon as you can. So you're not rushed on that last day. Okay. All right, next slide, please. Yes, so we've already spoken about all of this, but just set yourself up for success. Do as much research as you can prior and ask questions. So attend the information sessions for the LHNs. Reach out to us if you can't find the answer to your question in the handbook or the frequently asked questions. And you will be very well positioned for a great TPPP year. There are different intake dates available at different sites. So depending on your personal circumstances, you might want to take those into consideration as well. The intake dates are staggered from January through the first few months of the year. So please take a look at that as well. Next slide, please, Alyssa. Oh, thank you. And then, yes, we just say this is, again, talking about preferences, having a backup plan. The wider your preference, the more opportunities you will have. So please preference as widely as you are comfortable with. All right, now I heard Northern Territory speak to this as well. Our selection criteria is also based on merit. So we consider your application in accordance with your video interview and your referees, and we'll rank candidates and allocate them against their preferences in accordance with how many positions are available. So that's a process that we go through, but it is all via merit. So do remember that as well while you're doing your interviews as well. All right, next slide, please. Okay, so we're nearly finished and then we'll have a couple of minutes for your questions. Sorry, we have push time today. Applications close on the 19th. You'll have some additional time to edit your preferences. Please do as much research as you can. And another just great life career tip is do not share the interview questions. So we use a bank of questions, a library, and different people will be given different questions, but it does you absolutely no favours to share your interview questions with your friend, because in reality what might happen is they might do better because of the advantage you've given them, and then you don't get a job. So it's not something just for life. We'll never do that. All right. Now, people often ask about their criminal history screening. You don't need to upload that at the time of application, but please be prepared to provide everything when it is time, okay? So when you receive your offer, you'll be advised what other information you need to provide, and that will include criminal history screening, as well as immunisation information. So please be at the ready and please review carefully what is asked of you. So for example, for any working with children clearances, if they are going to expire within 6 months, please renew them. Immunisation screening, please know that we can't accept the university clearances. We'll need copies of serology. But all that information will be available to you. All right. And just a reminder, if you think that you're going to need to confirm your English language proficiency with APRA, please do that. If you do need to take an English language test, then you might want to select an LHN or an intake day that is a bit later if you feel you're going to need a buffer period to do that test, okay? And we will only make single offers. So if you decline an offer, know that you're not going to be made another one. Yes, and we just wish you all the best of luck. We're really excited for you. This is a wonderful time in your lives, and such a great achievement for you to be transitioning to a graduate program. So congratulations that you've reached this far, and we are really excited for you to hopefully join us at SA Health. This is a summary of the dates that we've mentioned throughout. But we'll throw back to the facilitators, and if we've got any time for questions, we can take them. Otherwise, we'd be happy to, if you'd like to send us some questions after the facilitator group, and we can respond and send them back.
I'd say we got 3 or 4 minutes for questions, but I'd just firstly like to acknowledge the work of my colleague Leticia to sort of get the event back online, and also thank you so much to Tim for your support and assistance from our IT team. So apologies all, and fantastic work, Stacey and team.
Oh, you're on mute.
I hope you heard some of that.
Yes,
just fantastic work, everybody. And we do have some questions in the chat if you want to have a bit of a look through that.
So there's a question about preferences and how they're considered, and are previous placement locations taken into account. Our process is based purely on merit. So no, I would say that placement locations aren't taken into account, but other aspects of the selection process certainly are. APRA recently changed their registration requirements. Do international students need to meet new language requirements? Please refer all your questions about APRA registration to APRA. I'm not sure if you've got anyone from APRA joining you today, but certainly they are best positioned. We wouldn't be giving you correct advice if we commented on it, so please go straight to them.
Not a problem, Stacey. We are actually having a Q&A with the nursing academic team, and might be able to sort of broadly pick up on some of those questions at that stage. The other thing we can do is capture questions and sort of maybe refer these to you, and then do a sort of collective response back, just to save a little bit of time.
That's okay. I can just see one other question about visa sponsorship, so I'll just speak to that quite quickly. Some of our sites do offer visa sponsorship, but some don't. So it depends on the site. And there are other things that we need to consider as well. So normally a TPPP position is part-time to support that transition, but to sponsor for visa sponsorship, you'd need to work full-time. So they are just some things to consider. It is possible, but not everywhere. So I'd encourage you to have conversations with those sites in advance. And please make sure that you include the relevant information in your application so that we can adequately support you through that. We do ask through the application that everybody provides evidence of their residency. And so if you do hold a visa, we ask that you upload it as well as your passport so that we can support you in knowing the best pathways for you. Now, I can't see any other questions, but that just might be my screen.
There's quite a few questions. There's one about can they apply for specific wards and specialities such as ICU within the hospital?
You're on mute again, sorry, Margaret. But
I'm sorry, I've got a dysfunctional mic. It's just switching on and off on me. So
I think that there's just something.
There's some gremlins in the system today, aren't there?
There are, for some sites, yes, you will be able to nominate a preference, a desire to work in certain areas. Thank you, Alyssa. Yes. But yes, that's something that's worked out at LHN level. Alyssa or Lisa or Steph, that's all I can see online. Do you want to add anything more to that?
I just think with the preferencing, with the regional LHNs, it's all a little bit different, but essentially what you'll be asked, so I think we've heard York and Northern have got 17 sites that you can, Eyre Far North have got 11. If you were to pick one of our LHNs, you, for instance, under Eyre Far North, if you picked us, it'll then ask you to rank which of the R11 sites, three rankings. So you might put Port Lincoln, Cooper Pedy and Kimber. Okay, so you won't actually get to pick the wards for some, but for others you will, I think, from Carlin and Metro. It's all a little bit different, but you can see that. Get into that application form early, start having a look, and if you've got questions, please reach out to your corresponding LHN for more information.
Yes.
Okay. So I think we might need to draw the session to a close at this point, but Stacey and team, thank you so much for your time today, your passion, your enthusiasm. Thank you so much for bearing with us. Again, I'd like to acknowledge the hard work of my colleague Leticia and the support of Tim from IT in getting the session back on track. We are so sorry about the disruption, but haven't gotten to, and Stacey, we might touch base with you to ensure we can get the answers out to people regarding that. So thanks again, and I now would like to welcome Sarah from Resthaven. So Sarah, please feel free to share your screen.
All right. Good afternoon, everyone. Thank you so much for inviting me today. Just to introduce myself, my name is Sarah Churchill. I'm one of the recruitment business partners here at Resthaven. Now, Letitia, I might need your assistance here because it does not seem that it is showing the very first slide. Now, I know I sent a copy through to you, so I'm just trying to see. Let me see if that fixes it.
See the Resthaven logo.
Oh, okay. That's all you can see?
We can see the first slide, 1 of 10.
Fabulous. I'm just getting a different view, so I just wanted to qualify.
Yeah, no, we're seeing it. Don't you worry. Don't you worry.
Excellent. So as I said, I'm a member of the recruitment team. I'm one of the senior recruitment business partners here at Resthaven. So today I really want to take you through a bit of an introduction, if you're not already familiar with Resthaven, as to what we do, nursing opportunities and information about our TPPP program. So I thank you for your time and thank you for your patience. So to get started, I want to talk a little bit about us as an organisation. We deliver high quality residential and community aged care services throughout metropolitan Adelaide and regional South Australia. We are a not-for-profit aged care community service associated with Uniting Church here in South Australia. We are very fortunate to have been an organisation that we are now celebrating our 91st year this year. We had our 90th anniversary last year. And so we're very proud of that. We're very proud of the services that we provide. Very much part of that is our values, which is trust, dignity and respect. So I'll just move on to the next slide. So with Resthaven, we really truly respect and embrace diversity. We are very fortunate to have a workforce of over 4,200 employees. We've experienced significant growth, particularly over the last couple of years, and particularly in our community services area. We're also very fortunate to have over 200 volunteers from many nationalities working across 40 plus locations here in South Australia. Now, the big question, why work for Resthaven as an RN? Working for Resthaven, it's not just a job, it's a career. You'll find meaning and purpose working together with us to provide high quality care to our older people and carers. As a not-for-profit, we are purpose-driven, not profit-driven. We are very fortunate to have a team and staff members from over 93 different countries, and with our clients and residents, they come from over 129 different countries. We, as I mentioned, a very diverse workplace where 55% of our staff are born overseas, and in fact that there are 71 languages other than English that are spoken by our staff. Now, as mentioned, we are an aged care provider, so we have the two parts of Resthaven in which we look to recruit and place registered nurses. We have our residential services, which is our traditional format for aged care, where our residents live with us. And we also have our community services, which is where we provide support to our clients so they can remain at home and live independently. Within residential services, we have our clinical nurses in clinical services, palliative care and ACFI, as well as registered nurses and nurse practitioners. In community services, we recruit for registered nurses, registered nurse coordinators and clinical leads. Now, I want to talk a little bit about our TPPP program, and the best way for me to summarise at this point is watch this space. Details are currently being finalised for the Resthaven TPPP program, and further details and further updates can be found on the Resthaven Careers website. I'm just going to pause on this screen for a moment to give interested applicants an opportunity to get their mobile phone camera out and to scan the QR code. Thank you. So I want to move on to essentially what we can offer at Resthaven in terms of career development and essentially stepping through and building on your skill base and what you have learnt and what you will learn as a registered nurse. We have an extraordinarily very well skilled and equipped learning and development team, and we do offer a very comprehensive induction and orientation program for new employees. We also have employee mentoring programs available, so you are supported as you develop into your role. And for our nursing and allied health staff, there is opportunities to consolidate your clinical skills and develop specialist skills in continence care, clinical nursing, palliative care, dementia care or wound management. We also have a professional development fund to further your career progression through ongoing education and professional development opportunities. I want to also just pause for a moment because I want to talk more about our career progression within Resthaven. We're very fortunate to have registered nurses who start their career with us, but because of the support and opportunities within Resthaven, we do have a significant number of our executive and senior management who originally started as registered nurses at Resthaven and have taken the opportunity to move through and take those development and further study options to develop their career. And it is something that we do very strongly at Resthaven, as I said, we are very proud of. And it's wonderful to see people move through and further develop their skills. So I know today we are talking about registered nurse opportunities, TPPP, but I also just want to take a moment and pause on the opportunities that are moving beyond RN into more clinical management and senior management roles that are available. Now, I just want to touch very quickly on our recruitment process. We use, as I was listening to the SA Health presentation, we also use the application page up to ask candidates to submit their applications. We ask that in the first instance that you go to our Resthaven Careers page, have a look at the vacancies currently available and any updates in relation to TPPP programs, and then to submit your application via the Careers page. We then go through a selection process, and we will of course keep in communication with you during that process, and there is contact details where you can contact the recruitment team for any questions you might have. Now, candidates who are successful after interview progress to what we refer to as our compliance check stage, which will involve a police check, medical, reference checks, qualification and visa check, and provision of vaccination evidence if applicable. I just want to note that with the police check and medical, Resthaven pays for those. None of our candidates incur out-of-pocket expenses in sourcing their own police checks or medicals. We pay for them. Now, again, just basically finishing up, I'd invite everyone to explore our opportunities via the Resthaven Careers website. And again, I have the QR code up there for your reference. So again, we'll just take a pause to give people an opportunity to get their phones out and scan the QR code if interested. And I just want to thank you very much for your time this afternoon and look forward to some questions being asked.
Thank you so much, Sarah. And it looks like we got a question in. I was just wondering if there are opportunities for further aged care certifications while completing the TPPP at Resthaven.
That's a very good question, Margaret. At this stage, I will have to take that question on notice because appreciate that through the TPPP program, it is quite an intense program where we're really focusing on nurses coming in and building on those skills. So in relation to being able to undertake further studies, I will take it on notice. I'll ask our workforce development team and I will get back to you. I'm just making a note of that now.
Fantastic. Good one. So please keep the questions coming through the Q&A function.
Wonderful. I'm just having a look now while we are all okay.
Yes.
I don't know. I think Z has asked about the specialised TPPP, like mental health and the general TPPP at the same time.
That might have been a question for SA Health, I think.
Yes.
Yeah.
I just want to make sure that obviously I'm not answering somebody
Absolutely.
else's questions.
No, we did open the event to students who were in the middle years as well as final years, so they can start thinking about that.
Absolutely.
And opportunities to, work as an assistant.
We certainly have opportunities for, and we do have a significant number of students who are studying either nursing or allied health who work with us at Resthaven in casual positions. And I said I'm mindful of time today, but those casual positions are very broad. It can be working in a hospitality role. It can be working in a role where you're working, for example, as a therapy assistant. So incorporating part of what you're learning as a nurse, also earning money while you study, which is really helpful. And absolutely. And also we have home support worker roles. We're again providing support to our clients. We have, as I said, a significant number of nursing students, both enrolled and registered, who are working with us at the moment. And it is also separate to obviously TPPP opportunities. While you're still in the middle of your studies, it's an opportunity, first of all, to have paid work, which is so critical. But secondly, see if aged care is an area that you want to look at post-graduation. And also, really critically, and I appreciate having worked through and been a graduate myself in a different field, it's getting that experience and getting those connections and networking opportunities. So yes, you're working might be working as a carer or a therapy assistant, but you get to know everyone within that team. You can start developing your networks. It's about then having an opportunity to have referees, so that you have referees who can attest to your work history and your work type and and be able to assess you. So it's a really valuable way to get that work experience and combine that with your graduate, obviously your degree. It's a bit of both, which is always valuable.
And we got plenty more questions coming through.
Okay.
We've got another question about professional development, any qualifications and certificates that are fully funded, wanting to know about the interview process. And another question, how do we know if the RN position is for graduate nurses?
Certainly. So first of all, I'll address about the certificates and what can be funded. As you can appreciate, Resthaven have a very generous model in comparison to other organisations. Some organisations, you actually have to complete further study, then provide evidence of completion before any compensation or reimbursement is given. We actually will provide you with funding at the start of your studies. So it actually starts at the beginning rather than reimbursing you at the end. Obviously, every single certificate, and we do offer ones that we provide through Resthaven, is on a case-by-case basis. So it's about you do need to make an application to support your request for study and for financial assistance during that process. But we do have that in place. Now, the second question, sorry, Margaret, it was
about the interview process.
Okay, the interview process. So I do know with our TPPP process, it follows a very standard interview process where you submit your application. There is a screening conversation where the managers and the hiring managers involved in that process will get in contact with you, or members of the recruitment team will contact with you. We'll then ask you to obviously submit documents, etc., to support your application. Interviews then happen, and then, as I mentioned previously, there is that compliance check process that you go through. So it is a very stock standard interview, but I also want to just allude to the SA Health presentation, which was absolutely amazing in terms of interview prep and what to do and what not to do. We follow the same principles as well, but it will be a face-to-face interview at our head office for the positions. And I always advise candidates to find out as much information about the position ahead of coming in for an interview. So you will be provided with a job description. Please read that. I always encourage people as well that regardless of who you're applying for, make sure you do your research about that organisation, because that's a courteous thing and a very professional thing to do as well, because it will set you up for success, because it demonstrates your interest in that particular position. And I think there was a third bit, Margaret.
We've got a couple more questions here. So there was the question around how do you know if the RN position is suitable for graduates? And then we've got one, if you've worked as a personal care worker in a community setting already, would this help for a TPPP in a community setting?
That's a very good question. Okay, so with the graduate nurse positions, they're very clearly delineated in terms of vacancies on our careers page. We are very, very prescriptive in terms of what we advertise for, and we make that very clear. One thing I didn't mention, I do apologise, is that interested applicants can actually go onto our careers page and register their interest in RN positions. So you can actually go in, provide your mobile number, email address, your first and last name, and you'll have an opportunity to say, look, I want to hear about all RN vacancies. So it actually means you don't have to keep going back into the careers page. When a new vacancy is advertised for registered nurses, be it graduate, be it TPPP, or a more conventional way into the organisation, you'll receive a notification email. So it gives you an opportunity to find out what's going on. But I will come back to, it's very prescriptive. We are very, very clear about the requirements for each RN position. As you can appreciate, particularly across residential and community, there are different requirements because each roles are very different in terms of the teams that you're working in, the level of autonomy that you have in your role. So that's why we always spell it out, basically, as to what the criteria is. Now, I think there was a further bit, Margaret. You're being very helpful. I really appreciate it. Okay, it's just gone mute, Margaret. I'm so sorry. If I just get you to just repeat that, that would be great. Okay, it looks like we're having issues again. Oh, no. Let me just see if I can see some of the questions. Okay, there was a question about how many positions you have available for new graduates this year. Thank you very much for that question. As I mentioned, we're in the process of finalising.
I can't hear her now.
Okay, I can hear you, Margaret. Okay, that's okay. We've got a question. I think you're on. Oh, okay. I'll just answer that question for everybody else. As I said, per our TPPP, we're in the process of finalising that. And once that's finalised, we'll be able to confirm the number of new graduates that we're looking for. And I'll answer that question about being a personal care worker in a community setting. Yeah. Would this help? With our TPPP, obviously it's critical you're going through RN, which is fantastic. And I really think that's fantastic that you're working as a personal care worker. we take everything into account with our TPPP program, but again, it depends. And just to clarify, whether you are being considered to be placed within a community environment or a residential care environment. But I would always encourage all applicants, particularly in your cover letter, and again, just harking back to what SA Health is saying, please don't use AI for your cover letter. We actually know when people are using AI. We want to see you. We want to see how you communicate, how you express yourself and demonstrate and show your experience, because we want to see your ability to critically think and apply those concepts. So even with your cover letters and resumes, please don't use AI. AI is very repetitive. It tends to spit out the same information every time certain bits of information are put in, and we can pick it up very, very quickly. We want to see you. We want to see you, not AI.
Thank you, Sarah. Maybe just a last question about how many positions you have available for graduates this year, and then we might close this time.
I just quickly touched on that, so that will be confirmed through TPPP. So as I said, I'd encourage everyone to go to our careers page, and we'll go from there.
Sarah, thank you so much, and I really loved your response there on the AI question. Absolutely.
It's very present.
Yeah, because the application is an example of your communication. So, yeah, and wonderful, all the questions. So, yeah, Sarah, it's been fabulous to hear about the opportunities at Rest Haven. Thank you so much for joining us today.
Pleasure.
So we'll say thank you and goodbye, and welcome to Tanya from Calvary, our next speaker. So, Tanya, you're welcome to join in and share your PowerPoint.
Lovely. Thank you very much. Can you hear me and see me okay?
We can.
So I also have Ryan here with me as well, so we'll be doing our presentation.
Thank you for joining. And yeah, I'm Ryan, and I had Tanya here with me as well. So we're the graduate coordinators for Tanya's peri-op, and I'm the acute stream at Calvary Adelaide. We also have a couple of graduate coordinators out at Central Districts, who's Camilla, and then we also have North Adelaide, we've got peri-op, which is Sam, and also Bianca as well for the acute stream. So we're just going to go through a little bit on, essentially, hopefully there's not too much lag, it's on SharePoint, but a little bit about, I guess, the hospital. So the newest hospital is obviously Calvary Adelaide, which is found on Angus Street there. This only opened in 2020, and it's actually the largest private hospital in South Australia with 344 beds. Has a range of specialties, so medical, surgical, also ICU, cardiac, the only 24-hour 24/7 ED department, or private one anyway, in South Australia. We also have Calvary North Adelaide, obviously in North Adelaide there, which is the one of the oldest private hospitals, founded in 1883. And this hospital has about 130 beds, and also has numerous specialties like operating theatres, day surgery, oncology, surgical, medical wards, ICU, and also the Mary Potter Hospice, which has palliative care. But they also have the maternity unit over there as well. The final one, there's Calvary Central Districts, which is the only private hospital between North Adelaide and Gawler, so provides sort of an option for private healthcare to people in those sort of northern suburbs, but also in sort of the Barossa Valley and mid-north and mid-York group as well. So in terms of the Calvary GNTP program overview, so it's a relatively early start date, so early 2027. This hasn't been confirmed as of yet exactly when that'll start, but this year it was in February. I guess one of the unique things about our program is that upon completion, you're guaranteed permanent employment within the organisation as well. There's supported rostering as well, as you can see there, for the first 3 months of the program, and generally no night duty for the first 3 months as well. So we tend to try and support, the graduates, and making sure that they're on shifts where they're, with senior staff and receive that support initially. There's an extensive 3 or 4 day orientation program, depending on what stream you're entering in, whether it's peri-op or the acute. And Generally in the peri-op areas, it's Monday to Friday shift work, so no weekends, so great for work-life balance. So we have fairly flexible FTE, but we do sort of recommend 0.8 or 8 shifts a fortnight, which is about 60 hours a fortnight. Generally for RNs, there's 2 6-month rotations in the acute and perioperative areas. And then we do also have our EN program, which may not be relevant to people on this, but that's a 6-month rotation in the acute space as well. We do have registered midwives and an RM GNTP program as well, but this is only out at North Adelaide, and this includes rotation through postnatal, special care nursery and the delivery suite. I guess the other thing that we sort of pride ourselves on is we have multiple supernumerary days at the commencement of each rotation. That does vary slightly depending on the area that you start in, but usually you're buddied with preceptors then, so you're receiving that additional support as well. So in terms of the program as well, there is 3 full-day study days. So these study days are designed to kind of look at, I guess, things that are relevant at the point of transition that you're in for a graduate program. And these are actually included in your FTE, so they're paid study days that are supported by the managers in each of the areas. Perioperative, acute and maternity have specialised study days as well, because obviously very different environments. It'd sort of be a bit silly to have the same study day across the board everywhere. Proud to have, I guess, the dedicated clinical educators in specialty areas as well, and these help to provide shoulder-to-shoulder support to grads as well. We have trained preceptors in each of the areas or each of the wards, and these provide additional support, and generally you're buddied with those preceptors when you start, so you know who you're sort of going to be working with and who you can sort of go to for additional support as well. We also have specialised competency books, and these are specific to your rotation, so depending on the area that you go in, so sort of designed to kind of, or tailored to meet the needs for each of the areas that you may actually rotate through. So I've sort of already introduced, I guess, myself and Tanya, but each site has dedicated graduate coordinators, so they're generally available to meet up, educate and also support regularly. We also have a dedicated graduate support team as well, who will go out and see grads shoulder to shoulder and sort of touch base, and there's someone, again, that's just another point of call. We've already mentioned no night duty for the first 3 months of the program. We generally try and tailor monthly meetings for the GNTP team, and this is where we can sort of look at setting specific goals based on your learning needs and where you're at in the program as well. And then finally, we have a graduation ceremony once you complete your program, which is always nice and fun. We usually have a photo in our sort of larger presentation, but yeah, they had held that at the, was it the Wine Centre last year, was it, Tanya? Yeah, somewhere like that. The gallery, sorry. So I do apologise, I'm quite new as well. I've just started in the last 6 weeks, so still getting to know the program. But I guess just for interest, I guess some of the topics that may be covered in the study days as well, depending on the area that you go in, can be seen on the screen there. So I'm not going to read all of them out, but we do focus a lot on transition shock and those stages of transition, A to E assessments, assessments in general. But then you can see there's, sort of specialised topics that are also covered in areas like peri-op, malignant hypothermia, things like that as well. So this is probably the nitty-gritty in terms of applications. So generally with the applications, we have our internal expo, and we've obviously got these expos now as well, but applications actually opened last week on the Monday, so the 11th of May, and they close on Monday the 15th of June. So we did have raised it, I think on the website it does say the 15th, but in the handbook, which I'll talk about, it does say the 14th, but it will be the 15th of June for those that do have that question. So applications have already opened. We've already started looking at those. In July, about mid-July, we'll start commencing interviews, and I'll talk a little bit about what that entails in the coming slides. Interviews may continue through to August, just depending on how many applicants and the spots that are available. And then referees or references will also be contacted in August. We'll start to provide provisional offers in September as well, and these will be offered until all positions are filled for the program. So this is the really important stuff, and this is found in the handbook, and there is a checklist available for applicants as well. But it's really important that you sort of address the criteria that we've asked for, because this is what we're marking applications to. So in terms of eligibility, you must not have been working in the desired role, so whether it's an RN/EN, for 3 months full-time in Australia or overseas prior to applying. In terms of what we require in the application, we require a 1-page cover letter. We really, I guess, pride ourselves on, the mission and values at Calvary. So we're wanting you to actually address Calvary's mission and values in that cover letter as well. And talking a little bit about what you're going to bring to the organisation. And if you can tie that back into the missions and value as well, or values and mission, that just sort of, I guess, shows that you've got insight into what those values and mission actually mean. In terms of your CV or resume, we need to see your placement history, so all of your placements, all of your employment history as well, and you can also include any volunteer work or any other relevant work that you think is, I guess, relevant to the role as well. In terms of referees, this is where we get a lot of questions. So we require 3 referees, and at least 2 of these referees need to be staff from your clinical placement and clinical staff as well. So whether that's your facilitator, whether it's one of the RNs, the manager, the educator in the area that you've actually been, that's really important. So we need at least 2 clinical staff from placement. We have had the query, especially from some unis, that if you haven't completed your final placement yet, some people have said, what if we want to essentially incorporate one of those referees into the list? So for the application, we just require you to actually include those 3 referees, and 2 of them need to be clinical. If you reach that interview stage, you can let us know that you wanted to add or change one of those referees if you've then completed a placement, but it really only required at that point. But to apply, you need to include the 3 referees. In terms of other requirements, we need your last or one summative clinical placement report from your most recent placement. So this is really important, and I guess the other question we've got is, some people are not doing their placements till later in the year, but that just means you need to include the summative assessment or report from your most recent one. So whether that was October or November last year, that's the one you'll include. The final requirement is just your interim academic record or unofficial transcript, and this needs to actually show your GPA as well, and you can generally request this from the university. So in terms of the application, so I guess the other important things is that we want to make sure that what you're actually submitting is easy to read. It's really important, and I say this to students that I've had as well, is that, get someone to proofread your resume or your cover letter prior to actually submitting, because quite often they might pick up grammatical errors or spelling that maybe you've missed. It needs to include all the points that are mentioned in the checklist, which you can access, as I said, through the application, and you've got the handbook as well. Those references or recent referees are really important to include, obviously, but it's also important that you let them know that you have actually put them down as a referee, because if we do actually contact them and they're not aware that you've actually put them down, that can be challenging. We also want to know why you want to work for Calvary. So what is it about Calvary Healthcare that you actually, I guess, draws you to it, and I guess why you think you'll be a good fit. And then do the mission and the values actually align with your own as well? So that's really important, and that's something that you can kind of talk about in your cover letter. So in terms of the interview stage, so once applications have come through and we start offering interviews, the format for the interviews will be face-to-face. We will offer some online interviews for people that are potentially interstate or maybe rural, but the format for the interviews is a group interview. It'll generally be 8 to 10 candidates per group, and in terms of those candidates as well, we'll generally try and group you to the areas that you've kind of chosen as your preference for placement, essentially. So for your rotations. The interviews will run for 1 hour. And in terms of what to expect, there'll be some introductory sort of questions in there. We want to know a little bit about you, where you fit in, video backgrounds. We'll also have some clinical scenarios. So this is really about I guess focusing on your clinical reasoning, your prioritisation, but also how you actually work as a team and communicate, within your group interview as well. And we do really sort of keep an eye on those things. You'll also have the opportunity to ask questions as well. So if there's other questions that have come up, you can actually ask us about the program. So I guess the advantages of working in a private hospital as a graduate nurse. So I guess you've got your choice of specialty. So when you actually apply, you get to choose what location is your preference in order of preference, 1, 2, 3. But then you can also choose the specialty areas. So, that might range from, surgical, medical, peri-op, oncology. The one thing we generally say is if you are interested in something like oncology or palliative care nursing, your first preference should be Calvary, North Adelaide, because they're the only ones that offer, palliative care, for instance. When you are offered a position, you'll know once we contact you where your position will be offered, so what your rotations will be, which is a little bit different than some of the other organisations as well. You'll have regular contact with the GNTP support team as well. You'll have exposure to critical and emergency patient care, and we also work directly with doctors and surgeons as well. So if you do want further information, obviously we've got Q&A in this session, but the QR code there will take you to the GNTP website, or you can access via the URL number there as well. And when you go onto the jobs or application page, you can actually download a copy of the GNTP handbook as well. So that's me all done in terms of my talking. I haven't checked. Is there any questions? There's a couple that have popped up by the looks.
Hi, yes, so please put your questions using the Q&A function. And we've got a question in there, Ryan, about referees. Can you see it, or would you like me to take you through it?
No, I can. So I think just to clarify about referees, would it be okay to use a facilitator from a previous placement as your third referee? Absolutely. If there's someone that you think is going to, give you a glowing reference, then absolutely you can pop them down. So
that's really good to know. Do we have some other questions?
I was going to say, adding to that, you don't have to use for that third referee as well. You can just use, your employer if you're working as an AIN or, as a personal carer somewhere, or you don't have to use the facilitator, but it is okay for you to if you want to.
That's lovely to know that you've got those other options as well. Now, we've got a question. If we're interested in ED and peri-op, how do we go about this?
Good question. Two very different areas. You need to, so if you choose peri-op as your first preference, you'll then get a drop-down box, which essentially enables you to pick the specialty areas in peri-op as well, the different areas in peri-op. So I guess you probably need to make a decision on what your priority area is, because if you put down ED as your number one priority, then you'd pop peri-op as your second preference or priority. So we sort of will group if you're successful, and then we offer interviews based on your preferences as well. So you will have the opportunity to actually put down what your preferences are when you're doing your application. Looks like we've got another one. popped up. So we prioritise students who... Oh, sorry there, Margaret.
No, you go. Did you prioritise, students who did a placement at Calvary?
There's no advantage in the application.
Yeah, so there's no advantage in the application. However, because we do have facilitators here and that, we will sort of look at the placement records as well, and any comments and that, because they'll often say, you know, exemplary student and would highly recommend, you know, having them. They had great critical thinking, that kind of stuff. So while it's not an advantage in that sense, we do, I guess, get a little bit of additional information.
Yeah, that context. Now, we've also got another question on referees. They've looked at the checklist. Referees must be from 2 separate clinical placement experiences. Would it be acceptable to provide referees only from my most recent clinical placement?
Yeah, I guess absolutely. One of the things that I would say is, you know, if you've got a specialty area that you've chosen, which is ED, and maybe you've done a placement in ED as your last placement, if you then include only 3 referees from your most recent, which is, I don't know, maybe surgical, then, you know, it might be nice to have someone from that ED placement if your preference or priority is sort of ED. That would probably be my only thing, is just thinking about, you know, who's going to give you, I guess, the best overall kind of example of how you practice and how you perform on placement. So thinking a little bit about that as well. But absolutely, if they're all from your final placement, you can include them in there. So.
And we've also got some questions there on how many positions are available.
Yeah, so probably like a lot of the other sites, it'll basically be dependent on, I guess, FTE and things like that. But I think it was last year, we had about 80 or 85 last year at all 3 sites. So whether it's around there again, but we sort of won't know that until a bit closer to the actual
Ryan,
day.
was that 85 at each site or 85 across the board?
That was across all 3 sites.
Across all 3?
Yeah.
Okay. All right. Oh, looks like more questions. We will be, we'll have to close soon, but we will be taking the questions and sort of doing some responses around those. So just a quick question on, can ENs be references?
If you're applying for an RN, you'd be preferred as an RN.
Yeah, I think if you're applying as an RN, because of the scope of practice being a little bit different as well, it's preferred that it's an RN or clinical nurse or educator or along those lines. If you're applying as an EN, it's perfectly, you know, okay to have the EN there. If you absolutely had to, you could potentially have them as a 3rd reference, but yeah, we prefer RN or someone that you've worked with.
Okay, Ryan, we might need to leave it there. So thank you so much to you and Tanya for your time, enthusiasm and passion today. And we hope you get lots of really fantastic applications, and we'll be in touch from here. All the questions we are collating, and we'll be doing our best to get back to you on all of those questions. Apologies again on our technological issues, and thank you so much for bearing with us. Have a great afternoon.
Thank you so much for the time.
Okay.
Thank you.
See you.
See you.
And I'm now welcoming Rebecca from ATCHA, representing Ashford Memorial and Flinders Private Hospitals. So, Rebecca, you are welcome to proceed and share your screen.
Thanks, Margaret. I will share our PowerPoint. Can everybody see? Margaret, can you see my PowerPoint?
Absolutely.
Great. Okie dokie. So as you said, I am Rebecca. I am the Education Coordinator for Memorial Hospital. We have 3 hospitals in our group, Ashford Hospital, Flinders Private, and then Memorial. So we'll just jump straight into it. I have listened to a couple of the other presentations, and there are going to be a lot of points that are going to be quite similar to everybody else's. But we've got you at ATCHA. So the 3 hospitals, we come together. We're a not-for-profit, and we are proud members of Adelaide Community Healthcare Alliance Incorporated. And what it means for you is that you can transfer between sites, and we partner with large private hospital groups to provide national education programs, and we have a new specialty program for peri-op and midwifery. Ashford Hospital, one of our largest private hospitals in Adelaide, It's considered a centre of excellence and has been servicing the South Australian community for 70 years, or actually over 70 years. Hospital was founded in 1950 when the local councils of Marion, Mitcham, Unley and West Torrens came together to establish what began as Ashford Community Hospital. The council names continue to be acknowledged as names of the wards within the hospital today. I'm not going to go over all of the points that we have on the slides. Feel free to have a quick look at those. But obviously, a lot of our specialties will be the same across the board, with the exception of maternity being offered at Ashford and emergency. Flinders Private is purpose-built in 1999 and it's co-located with Flinders Medical Centre. It feeds into our cath labs and the Cardiac Emergency Centre. And we enjoy a really strong working relationship with the adjoining public hospital. And it's just, we don't have an emergency department there, but we have the Cardiac Emergency Centre. So we have that as part of our specialty program for general stream. The Memorial Hospital, established as a memorial to the veterans of World War I. The hospital has served the community since 1920 and our landmark heritage building is situated in the picturesque parklands of Adelaide and only a kilometre away from the CBD and walking distance to Adelaide Oval. Between the three sites, we have over 2,500 staff and about 1,800 of those are nurses. So we have three program streams. We have the general, perioperative and maternity, which is at Ashford only. The general streams, it's really important to know that critical care unit, emergency, paediatrics are all part of the general stream. And then we have the perioperative stream for scrub scout, anaesthetics, recovery and day ward or DOSA. Maternity offer antenatal, postnatal, nursery and the labour ward as well. So our program doesn't seem too different to most of the others that you've heard about today. We have the preceptorship model. You have 5 paid study days, which are compulsory for your program, ongoing clinical support and regular debriefs. We have graduate lunches, graduate consolidation year as well. So the year after your graduate program with us, you are a permanent employee and we do offer scholarships to further your career goals as well. We prefer a minimum of 0.8 FTE, although we can negotiate a little bit less based on circumstances and an exceptional applicant. We do offer for RNs, ENs and registered midwives. We do 2 days of state orientation and for the last couple of years we've been at the convention centre for those 2 days. A 1 day of site orientation and your first 3 days of supernumerary in your ward are a minimum. Sometimes we need more and we acknowledge that. It's really big change going from a student to a nurse. Then we have 2 supernumerary days minimum for your second rotation and we do offer the 2 6-month rotations. Some circumstances our enrolled nurses like to stay in one area for the entire 12 months and that's also by negotiation with the NUM and the nurse. We have additional ad hoc education as well, which is offered on a monthly basis to the entire hospital. And your graduation evening is held as a big cohort all together with our exec team and CEO. So the perks that we have here are salary packaging, annually $18,550. We can also do novated leasing on top of that. And then we have the SURF, which is a Staff Education and Resource Fund. And you can claim up to $2,000 every 2 years within the SURF to go to conferences and professional, partnerships. And when you buy membership with people like Acorn, if you're in the peri-op stream. We have an extensive EAP and it's not just for counselling. We have financial assistance, legal assistance and career assistance in there. We have access to the passport and we offer a bespoke talent development opportunities to accelerate your career quite quickly. In further study, we have scholarships available for doing postgraduate study and we have an agreement with UTAS to help subsidise those. And then, of course, we can transfer within the organisation to the other 2 sites. So that's a nice little thing to have. You can do part of your graduate year with Memorial and part with one of the other 2 sites. And it was always by negotiation, but dependent on what specialties everybody wants to do for their graduate year. We are family friendly and we have very flexible rostering. So the big ones, our application process. Obviously you apply, and then the interview stage and pre-starts checks and onboarding and your first day at the hospital. So what I would say to everybody is please don't leave your questions to the last minute. Our ad is open for only 28 days. And if you have a burning question or an issue at 11:30, the night that the applications close, you're going to be in a bit of strife because it runs on Australian Eastern Standard Time. And we had many, many emails from people saying they couldn't apply because it was closed, because it closed at 11:30 South Australian time. So don't leave it for the last minute. Provide your CV, please, your cover letter, note your area of interest and why you want to go there. With the general, I said before, we include paediatrics, cardiac, ICU, although they're very specialised areas, they come under the general stream. Then we have the peri-op stream, which is DOSA, DSU, recovery, scrub scout and anaesthetics. We like your most recent placement reports from third year, so we want both third year summatives. And when you're uploading your documents, please upload everything. If you think we might need it, please upload it. Let's make sure that your applications are genuine. Access your university resources for your resumes. Be a point of difference when we're looking through 700 plus applications. We want you to stand out. Utilise those services that university offered in developing your resume. Please pay attention to details in your application. Make sure the hospital that you are uploading your cover letter for is for the hospital that you're applying to. Seek out who the people are that you're applying to. If it's myself here at Memorial, or Carrie Ann over at Ashford, or Carrie or Jamie over at Flinders, have a little bit of a research and see who we are and actually address your letters to us rather than just hiring manager. Please do not run your cover letter through ChatGPT. We can tell the difference between a genuinely written application with attention to detail and those that have come through ChatGPT. Please consider your vaccinations and is your evidence up to date, and know that the university signed off vaccination form is not approved for hospital employment. We need the actual evidence of serologies. So where we ask for them, please provide them. After your interview, we start the pre-employment checks, which incorporates all these documents. So if your documents are already there and uploaded, it streamlines the process much quicker. And then pending pre-employment checks, we get to offers quite quickly. Verbal offers are given and they're conditional to all HR checks, passing of your degree and registering with AHPRA. Our applications open on the 2nd of June. This QR code, I'll leave up for a minute or so, is our expression of interest. And you can log your interest now with our organisation, and we will send you the link when the applications open on the 2nd of June. And I think we'll got that QR code to the university, so you guys will be able to access it from them if I haven't given you enough time to get to it now. Failing that, you can keep an eye on the At Your Careers page for more information, and you can go in and see a little bit about our graduate program. And these are some of our very first cohort of mid-year intake graduates that you can see at the screen there. This QR code is a link to our careers page. And that's it for the actual presentation. I'll stop sharing my screen.
Okay, thank you. We've already got some questions in our Q&A. So the first question is, can you express interest in peri-op and general?
Yes, absolutely.
Great, that's that one done. And we got one here. What if our second, third year placement does not start until July and we don't have a second summative assessment by the close date? I know you've encountered this before.
We have, and we bring you to interview and we'll ask you to send it to us once you have it. We're very well aware that most placements don't finish until August, and then some won't finish until November, and that's perfectly fine. We accept them to be post-dated to us.
Yeah. I know it's a concern for a lot of people, and we do get this question each year. Fair enough too. And does ATCHA have a TPPP handbook?
We do. It's very extensive and it's very glossy and pretty, and I don't have one on hand, I don't think, to show you, but we have an electronic one that gets sent out as well from our from our talent acquisition team. It's a very lovely book. I don't know if you'll be able to see it.
Oh, wow.
With my face.
Yeah, getting a bit of a, getting, yeah.
Yeah,
Yeah.
It's a beautiful, glossy, big book with lots of information and pictures about previous graduates who have been with us. Yeah, it's a really lovely little book that we have, but we do send that out electronically. Yeah.
Fantastic. Good to know. Do we have any other questions? I was interested in your comments on AI and picking up the use of AI in applications. We'll just see what this question is. I think you mentioned it in the presentation, but is it possible to apply one rotation in Memorial and one at Flinders Private?
Yeah, what we ask is when you do your application that you put down your top 3 preferences for site and area that you want to go to. And when our state nursing educator, Trudy, goes through all of those, she will put them into the buckets of which place you want to go to. Mm-hmm. And if there is a place that you want to go to both, they'll flag it with both of us and ask you to interview at the first place first.
Okay, and will the rotation be in different fields if I'm in a specialty program?
It can be, yeah. So last year and this year we've had a couple of graduates who have gone from the wards up to peri-op. Yep. It's not out of the realm of possibility. We do offer the crossover if it's appropriate, if you've got a burning desire, if you've had experience and didn't quite get there. And sometimes, like for the last 2 years, we've had graduates who have started in DOSA or recovery, and they've done so well in those first sort of 2-3 months that they've actually accelerated to a new pathway, and it opens up another place within the peri-operative department or within another specialty area like paediatrics for people to move around. So it's not set in stone just because you're in that one to start with. Things often can and do change. Yeah. Yeah. I think I didn't mention though in our presentation because I sort of skipped right through it because we're, how late we're running, but we do no night duty for the first 3 months for any graduate and no relieving for the first 3 months either. We want you to get that foundation in your specialty area, which is really important to get comfortable and get to know your area and your people before you venture out on other little adventures.
Yeah, that's good to know. And got time for a few more questions, I think. So you mentioned AI doesn't, is very easy to detect for you. Yeah. I'm sensing some.
Yeah, if I read one more time that I'm passionate about this because it's the pathway for my career, it's so generic, and you can tell because we get 600-700 plus applications. Wow. And we have the same paragraphs that are mimicked throughout a lot of these applications. Yeah. We want to know about you. We don't care about a chatbot. We don't care about AI. We want to know about you, the person, Yeah. If you have a keen interest in, crochet or quilting or surfing, put that stuff in there. We want to know about your personality as well. It's not just about the clinical person that you're going to be or want to be. It's about who you are as a person, and we want to support and nurture that. These things are important to us as well because we're like a family here. Yep. Yeah. Yeah. Oh, look, that's absolutely great advice there. So, I'm interested to sort of, explore that, and certainly something that we reinforce when we're talking to students. And we're well aware. Yeah, we're well aware that the universities have these services that are free to students to help them develop their resumes and their CVs. Use what's available to you. And look, you mentioned 600 to 700 applications. Now, I might have missed this, but how many places do you have? This year we took 70 graduates over the 3 sites. 70 or 17? 70. 70, yeah. Yeah. Okay, that's also very, very good to know. Well, do we have any other questions? Because I think we've got Kim's here, and we've got a little space for some Q&A just straight to the, Kim from the academic side. So just leaving it open for a moment to see if any of you have any further questions. We've got another post. Could you please explain what the interview process looks like? How many rounds of interviews are there? Generally, 1 to 2. And I say 1 to 2 because I will interview with the peri-op educator here at Memorial, and then you will go to probably a second interview with the peri-op NUM as well as the educator if you are a standout candidate for a specialty area. I do all of the interviews with our clinical support nurse for the entire hospital. So it's a lot of meeting of new people. What we do is sit down, we have a general chat, we go through some clinical questions, we look at a scenario of, a clinical deterioration scenario, and just kind of get a feel for what your critical thinking is like and where you would go with that patient deteriorating, and what's appropriate, and where your base of knowledge is, and that's something that really determine. And we do a scoring on each of the criteria within critical thinking, and then we open it up for questions at the end, and then just talk about our program a bit more, about how amazing we are and how much you should come and work for us.
Of course,
essentially, why would we not, right?
Yeah.
So for general stream, it's generally just the one and done, and then it's the long process of HR checks, which gets handballed to human
and look,
resources.
We've just got another question. It's a good one as well. Is the interview conducted online, group, or in person? From what you're saying, I suspect it's more in person.
Yes, so generally in person, and it's just two people plus the applicant. Sometimes different areas have panels, but mostly 2 to 1 is where we sit in a nice little comfort zone there. It's not out of the realm of possibility though for Zoom interviews or Teams interviews. We've done a couple of those, and there have been applicants who have come from Western Australia and Northern Territory and Perth who we've taken in, and they're still with us now. So standout applicants, ACT, they will, it doesn't matter where you live. If you're an external student and you're all online, it doesn't preclude you from an interview at all.
Absolutely. Good to know.
Yeah.
And
I mean, no panels. We don't do like a big group interview. It's all personal. We want to know
because
you.
I mean, across the whole day, we're hearing about pre-recorded interviews, group interviews. So there's such a diversity of recruitment processes that it all goes through. So someone's curious to know how they can get the handbook sent to them.
I'd have to ask the state nursing educator, Trudy Perry, to see if we're sending them out prior to employment. I would, in the past, I don't think we have sent them out prior to employment, but that's something I can ask her and feed it back.
Yeah, good to know. And again, we might check back with you, Rebecca, on some of the questions. So we're just sort of collating up all of the questions so we can, maybe generate some FAQs and equip people even more going into the next round next year. Do you guys do some mid-year recruitment?
We do, yeah. So we endeavoured to not do a mid-year intake this year, but it's turned out that we are doing a mid-year intake.
Yeah, I noticed the position,
Yeah, so we've had some changes, and like I said, when people move around and excel in one area and want to see something else, they get to move. So it's opened up the need for us to do a mid-year intake. So we have kind of taken, I think, 6 here just at Memorial this year for a mid-year. I think we're taking 4 at Ashford and a couple probably over at Flinders as well.
Okay, good to know. So, so people should really keep an eye on what's happening in that recruitment space.
Yeah, and we start first or second week of February every year. So, being available to start in early February is always paramount as well. Don't plan your holidays for Europe in February because you won't be able to start with us until mid-year if we do it.
Oh, we've had a question. Can we drop by at your hospital to get the handbook in person?
No, unfortunately, we don't have any printed copies just to hand out because it's now gone electronic. Yeah.
Okay, so that's, again, good to know. Okay, well, if there's no further questions, Rebecca, thanks so much again for bearing with us. Thank you for your time today, and wonderful, wonderful questions. So are we able to move to Kim? Kim, are you there? Rebecca, thank you.
Thank you.
It's like a seance, isn't it? Are you there? Are you there? I'm definitely here. So well done on all of your technical hurdles.
We've tried to do a meeting extension. We're not sure if that's worked. So look, let's just hit it and get the questions up online for Kim, everybody. So, and again, I'd love to thank you all for all of your questions, engagement, and keeping with us through the challenges that we have had today. And we're very apologetic about those. So Kim is here ready to take your questions. So please use Q&A. I know we were getting some questions around APRA and a few things like that.
Look, how about I talk about the very common questions that we get? So
Kim, that'd be fabulous.
One of them is, when will my degree be finalised? So your degree will not be finalised until all your assignments are in and marked. So really, some of this might be up to you to make sure that things get in on time and there's not too many extensions. The other questions are around when will the university send off all of my information to APRA. That will not occur until the grades are finalised. So when the grade gets finalised from the topics, so for example, 3013, whatever the last availability is, when your placement is finished, if you've done all your makeup shifts, it will get finalised from us as the academics, then it's sent off, and then there's a lot of admin that's required to make sure that all of your topics are checked, everything's in order before a notification is sent off to APRA. That can take 2 weeks. And it does get a little bit stressful towards Christmas because you will have another topic that some of you will be doing 3012 later. So I just say, please get your assessments in on time and make sure that get your PARs all correctly, because currently for 3011, we're sending back large numbers of PARs that are not completed correctly. So make sure you get everything all correct so that will make it easier for us. The other question I get is, what date do I put on my application to APRA for when my degree finishes? That is the 31st of December. Because you need to put you may finish your final placement in November, but you probably still got grades to come in. So please do not put an early finish date on it. So if you just put the 31st or whatever the last day is for the university, which I can't remember, it might be about the 20th, maybe it's the 20th. I know it'll be later than the 20th. It'll be maybe the 23rd of December. So whatever date that is, put that in, and then that will mean that you don't have to get extension to your APRA application. I heard Rebecca saying that their intake for their TPPPs is in February, so we endeavour to get everyone sorted by then, but there will be some students who are not completed by that time. Have we got any chats in there? No. Oh, could you share programs and supports in regards to graduate application from Flinders University? I'm not really sure what you mean, Yunson. Could you share programs and supports in regards to graduate programs applications?
Kim, I'm expecting that would relate to career services supports.
Yeah, I think so. Yeah, so some of that stuff, I presume, is on the Career Hub, Meg.
Absolutely. So, you've all done those assignments through Nursing 3010. So I'd suggest you check back on what you've done there. And there's a lot of resources on Career Hub. We'll share those and other supports to you in post-events communications.
Okay, great. Any other questions? There will be some. You can always ask, because I am the third year level coordinator, so you can always ask, but I will just tell you it does get very tense around the end of the year. Please remember that we are all working to support you, and a million emails will not mean that we can do things quicker.
And look, there's a question around which hospitals do mid-year intakes. Well, you've heard from ACHA. I think at the moment, I'm not sure if it's a Health Scope Griffiths Rehab, or one of them might be. But what I really encourage you to do, which we talked a little about in Nurse 3010, is to make sure you have got yourself set up on job boards, you've got your profile set up, you've identified employers in the areas that you are able to job search, you've joined talent communities, signed up to get job alerts. So make sure you're doing all of those things so that you can follow any of those recruitment moves. Follow them on their social media, check in on their graduate recruitment pages. Again, I've noticed there's a couple of mid-year programs in SA open at the moment. There's certainly a lot interstate. So we might get back to you further on that one. We've also got one, what if some of the LHN have intake in January? Will everything be finalised?
Well, this is always where it gets a bit tight. So you will, depending on what bundle you're in, your placement will finish sort of mid-November, and if everything goes smoothly there, then we will have your grades finalised. If you have, unfortunately, you have sick leave or you have to have make-up placement, that will drag it out towards December, and that's when it gets a little hairy about getting the grades and the PARs finished. Exactly the same with 3012. So aim to get your assignments in on time so that they can be marked within a timely manner, and then that way we can get it all done and dusted by the end of the year. But sometimes you can't help it if you're unwell.
I'll just add in here, just going back to the mid-year intake, AMPLA is another one who are doing a mid-year intake at the moment, and I believe they're attending Health and Community Careers Festival, which will be held 6th of August. So do keep an eye on that. That's another great opportunity to meet employers in person and ask some of these questions. We've got another question there, Kim.
About the English language proficiency test.
Yeah.
So my understanding is that it is a self-declaration. I can't guarantee that that's the correct answer. Because I missed part of what SA Health said, sometimes they also have did they say anything about English language?
I think that's going to be covered by their FAQs. Just give me a moment.
Because previously what they say is that you can self-declare that your English is proficient. However, if in your interview they don't believe it is, then that becomes an issue.
Here, I've got the response from the FAQs, so I'm just going to drop that in there. So do check. Sorry, I'm just trying to get this done here. Yep, this is just pulled directly from the SA Health FAQs. Yeah, so SA Health is saying it's not them. It's through APRA is my read on that one, Kim.
Yep. So I think, and the English language proficiency test does not just apply to international students. You can be a resident in Australia, and they can still ask questions about your English language proficiency. So that's up to you to make a decision about that.
Yep. Okay, great. Anything else come to mind, Kim, about some of those common questions that you get? Because it'd be great, we might be able to develop up some Flinders FAQs.
They are the main questions that I get.
Yep.
When is my final date and when will I have my grades? Yep. There might be another question about early graduation. So normally our December graduation is in and around about December the 15th. I'm not really sure of the actual date this year, and that also gets a bit tense because you cannot graduate unless your grades are finalised. So for students who are doing late placements or doing 3012 in that later availability, everything has to be done and dusted before you can apply for your early graduation. And so a lot of that is on you, but some might. We know that when we have placements in ICU at, is it Flinders RAH? we can't get the full, oh no, we should be okay this year because we've changed it 7 weeks placement, not 8. So we shouldn't have that issue, because previously we had to get that extra week placement in and it couldn't be done at the placement facility. So that's the other issue. A lot of the time your hours, if you need to make up hours, cannot be done at your makeup facility. Usually what happens, if you've got a lot of hours to make up, it doesn't happen until January. So that's when it gets very tight for students if they've taken on a January TPPP. But if that happens, sometimes we can have communication with the facility if we know a set time that you're going to complete.
Yeah, so keep the communications going.
I think 3rd of January is a little bit tight. A TPPP starting on the 3rd of January, you're going to make the timelines very tight, because not only does the university close, but APRA closes.
Yeah.
And they are closed for about 2 weeks and don't process any registrations. And remembering that they do registration not just for nursing, they do it across all healthcare professions, and lots of people are requiring that to happen. So a lot of patience is required.
Okay, I'm not sure we got another question.
I can't see one. I did hear the ding, but I think there's a bit of a delay.
I think there's a delay. I think you're right. Oh, hang on. We've got, do international students who've completed their nursing degree at Flinders, are they still required to sit an English language proficiency test as part of APRA RN Reg, whether completing the degree domestically is sufficient to satisfy that component?
My answer is no. That's what my question is. That is, it's APRA makes their own decisions about this. So it will be up to the student to decide whether or not they need to do the English language proficiency test.
Yeah. Okay.
And I would say that if you are someone who is, if you feel you need to increase your clarity around your language, that's going to be a great goal to have on your placements.
Yeah,
put some things in, and get feedback on your peer review, on your peer assessment documents, on your preceptor documents, and say, can you tell me if you feel like I've improved or something like that?
Yep, good tip. Okay, well, great questions here. We will be doing post-event communications, of course, so we'll get the recordings all pieced together, make sure you've got all the links to all of our key resources. You can find us via Ask Flinders if you have questions for careers. If your questions relate to employers' programs requirements, we do suggest you check in directly with them. So you've got all of those website links, handbooks, and everything. Do make sure, if you're going to ask a question of an employer, that you have read the handbook and FAQs thoroughly. And we will also be hosting all the slides for you from wherever the employer's given us the permission to do so on our showcase page for nursing. So you'll have access to that. So we just do a little bit of getting that updated, and then we'll send that email through to you all as soon as we can. So if there's no further questions, we might draw the event to a close. Again, really acknowledging the work of my colleague Leticia in coordinating and doing all the behind the scenes work on this event. Thank you, Tim from IT, for your support. Thank you all the students who've attended, all the employers who've attended. Kim, thank you so much for giving your time and expertise also.
And thank you to Meg for facilitating.
Always a pleasure. So we hope you found this day really, really useful. We wish you all the very best for your applications, and look out for communications from Career Hub, because we'll be sending everything through to you possibly early next week would be our timeline. So get some fresh air, have a great day, and thank you everybody.